from Molina. Our friends from Molina are here. All right. Deshay is here from Pueblo of Tesuque. Lori Fierro, be well. And Eileen McKinley from Grant County Community Health Council. Welcome, Eileen. Melinda Sanchez, Community Health Worker, our CHRs, CHWs, critical partners of public health as well. All right, my friends, we are going to start our kickoff, our New Mexico Community Collaborative Forum. We want to welcome you all, 63 strong and counting. Again, these convenings are curated in response to all of you, what all of you have requested. That's important to stay informed, to have questions, have discussions, see where alignment is, where we can collaborate to serve communities more effectively. Tenemos un servicio, we have a translation service today, un servicio de interpretación en español. Tenemos aquí a Denise, Amparo.
Gracias.
Sí, sí, Tina, muchas gracias.
Angelita,
Aquí estamos.
gracias.
Sí, estamos muy felices. We're very happy to be able to provide this service, and thanks to our partners at NMDOH for making it happen. So we're gonna start off with our land acknowledgement. Sam, if you would mind.
Absolutely, thank you. And then just so you know, the translation services are on now, so you can find it at the bottom of your screen to go ahead and join that. Okay. The New Mexico Alliance of Health Councils and the Community Collaborative Forum would like to take a moment to acknowledge that we are gathered here on the traditional homelands of the Tiwa and Keres people, including the Sandia Pueblo and Isleta Pueblo. We give sincere gratitude for the opportunity to live and work here on ancestral and unceded lands that have been cared for by our state's original peoples of the Apache Nations, Pueblos, and the Navajo Nation. We honor and respect the indigenous cultures, traditions, languages, and the rich contributions that continue to shape New Mexico. Together, we acknowledge the history of genocide and impact. We acknowledge the history and impact of genocide, dispossession, colonization, and ongoing systemic inequities on Indigenous communities. As a collective, we commit ourselves to working toward justice and reconciliation, dismantling inequitable systems, standing in solidarity with and respecting relationships with Indigenous peoples. The Alliance affirms Indigenous sovereignty, self-determination, and self-governance of New Mexico's tribes, pueblos, and nations. In offering this land acknowledgement, we encourage you all to reflect on your own relationship to the traditional lands and take concrete actions to dismantle systems of oppression where Indigenous peoples are empowered and celebrated.
Thank you, Sam. And we have some welcoming remarks from our dear Lieutenant Governor Howie Morales. So Sam, if you're able to play his video, we would really appreciate it.
Good morning, everybody. Welcome to this Community Collaborative Forum. I appreciate the effort that has gone in to make this happen and the discussion and the updates that are so important that we continue to have, especially during these times that seem to be more uncertain than ever. It wasn't too long ago that I had an opportunity to address you and provide a keynote message of collaboration there at the previous Health Council's gathering that we were able to do. You know, a lot has happened since then. And we recognize that just a couple days after an election that's going to change up leadership in many parts of our state, it's also important to recognize that we continue to stay the course and continue to work in that collaborative effort that has got us the results that we've needed to this point. When we recognize in the discussions you're going to have today, updates on behavioral health and mental health funding, opportunities for transportation and connectivity, the importance of what we talk about, the most vulnerable needs that are important for people across our state, like food, like shelter, like safety and healthcare. I'm grateful that we have our agencies who are part of this discussion today to provide updates and allow you the opportunity to ask questions and to get some clarification on things that may or may not be happening. You know, we just recently came out of a special session, And the special session was simply to ensure that we're going to take care of New Mexicans, that we're going to do all that we can to ensure that the most basic needs are taken care of. Because of whatever is happening in Washington or not happening with the government shutdown, I'm not as concerned about whose fault it is at this point. What I want to make sure that we're doing is that we're working together to recognize that in the state of New Mexico, we're going to take care of the people that we're responsible for. We did that during this special session. We were able to get some funds in there to ensure that we were going to protect our most vulnerable. But just recently, we also made an announcement that we were going to go in and provide our SNAP benefits with funds that we have from our own state budget. Now, it's the responsibility of the federal government to do so and to pay us back once it's over. The important piece of it is right now is that we're going to do what we can to make sure that they are taken care of so that families don't have to go without having those benefits available to them. Because as I shared at the press conference, I was one of those kids who grew up on benefits like food stamps, and recognizing that at the time when there was the use of the food stamps were like in the form of monopoly money, and going to the local supermarket, having to purchase some items, it wasn't always the most comfortable thing to do, but I understand what families struggle with. I understand what those families that are affected by the shutdown right now are going through. And because of that, you see this sense of urgency and perhaps some frustration in me in recognizing that we must do the most basic thing when it comes to government and public service, and that is looking out for one another. That is exactly what you have done and continually do, and what this forum allows you the opportunity to find ways to have discussions of how we can further take care of one another. At the end of the day, we're all New Mexicans. At the end of the day, we're all people who care about each other. Your insight, your suggestions, your comments are absolutely valuable, because as we talk about this right now, you see the state moving in a direction that is very much opposite of what we see that's happening at the federal level. Extremely proud of our governor and the leadership team that we have when it comes to our educational components and caring for the well-being of our children, and that New Mexico now is the first state in the whole nation to provide free childcare. And by providing that free childcare, we put dollars right back into families, into communities, into small businesses, and ensuring that our children are safe, cared for, and they're educated. That's the type of leadership that we're going to continue to provide, but we can't do it without you. We can't do it without your expertise, your knowledge, and your connection to the communities that you serve. So please continue to share your suggestions, and know that in the state of New Mexico, we're not going to let politics rule the day. We're going to work together in an effort to take care of the people that so depend on us to do so. So thank you again. Look forward to connecting with each one of you soon.
Oh my goodness, a big, big wholehearted thank you to Lieutenant Governor for his welcoming message, his heartfelt remarks. And indeed, right, we're in this together, my friends. We say it, right? Together, we're so much more stronger. We've been in this place before, unfortunately, with emergency response efforts, with self-organizing, self-mobilizing, and that's why we have together created this space. And it is truly, truly inspiring to see so many partners here, community representation, advocates gathering, and just to highlight county and tribal health councils, of course, public health professionals, various community coalitions, and we'll give you an overview here in a little bit, tribal leadership, service providers, state agency partners, elected officials. We have their attention, their ears, their presence is here today in this space, wanting to hear from all of you. And what really lifts my heart, my friends, is that all of us are here united with one shared purpose, right? To improve the health and well-being of our communities. We know that these are challenging and very complex times, and we are navigating these unprecedented times together with shifting policies, funding uncertainties, and of course, the growing needs, right, that touch every aspect of life. As Lieutenant Governor said, from behavioral health to housing to education to food stability to access to healthcare and transportation. Yet, I think, in the midst of all of these challenges, one truth continues to shine through for me. Um, at CCF planning meeting and all of you, we feel that our greatest strengths is our collaborative spirit. And we saw it. We saw that spirit shine through as we were navigating COVID, right? And we are navigating similar unprecedented times, just in a different way. And so we are our greatest strengths. When we come together across sectors, across systems, across communities, we create solutions that not one single organization or entity can achieve alone, right? And that's our superpower, my friends, our collective dedication to ensure that every New Mexican, every community member has access to essential services, crucial resources, healthcare, so that they can live a healthy life, right? So today, my friends, it's about the 3 C's: connection, coordination, and collaboration. It's about listening to each other, learning about these timely updates, sharing information, asking questions, seeing where our work aligns, right? Where do our efforts align, and how we can collaborate and work together more effectively to serve communities more effectively. So I understand that we're all holding a lot. I appreciate you all carving out time this morning. 150 strong CCF members coming together, showing up, contributing your voice, your expertise, right? And highlighting the work that you do every day in service of communities. So we welcome you all. Thank you for being here. And we're going to get started. If you're just joining, we want to let you know that we have Spanish translation services. There is a little icon that you can click. Para nuestros amigos, I'm just going to say it in Spanish, tenemos servicio de traducción a su disposición. Solo tiene que hacer clic en el icono del globo para activar la traducción en español. And I want to give a big shout out to Marie Velasquez, our friends at the New Mexico Department of Health, for making this translation service a reality, a possibility. And once again, if you're just joining us, I want you to know that the CCF convening, how it is curated, is in response to you all. When you tell us, Val, CCF members, these are the things that are important to us, to our communities. This is what we need to hear about. This is what our time together today is going to be, and to learn from each other and see where we can link arms, right? And serve our communities more effectively. Thank you, Sam. We're going to drop in the chat. We always want to give you, reflect back your feedback from the previous CCF, August 20th. So Sam is going to drop this overview of who came together in August, the representation, the top priorities that people touched on, voiced, and wanted to learn more about. I need my glasses. You turn 50 and your vision changes. Urgent public health challenges in New Mexico pressing now, as you can imagine. And so this convening today is in reflection of what you expressed during the August 20th CCF. If we can move to the next slide, Sam. Another piece of information that we've curated in response to what you've requested is a resource guide. And of course, given the changes with SNAP benefits, and we're grateful to our executive branch and legislative body to convene during a special session and make sure that there's SNAP benefits for New Mexicans in these next 10 days, November 1st to the 10th. There's going to be in that resource guide a lot of resources around food accessibility, which partners are out there working on ensuring food accessibility, food banks, food pantries, and so forth, and statewide resources like 211, Share NM, where folks can also research what kind of resources are available in their community. And of course, we'll be hearing from our friends at the closed loop referral system at the Healthcare Authority. But please do let us know if there's any additional information you want reflected in this resource guide. Share it with your networks. Join the CCF. You'll have access to all of this and more. Sam, if we can move on to the next slide. So the first part of our hour together here is going to be with our friends at the New Mexico Healthcare Authority, touching on the closed loop referral system, on timely updates about the Behavioral Health Reform and Investment Act. And then, of course, our friends for the New Mexico Department of Transportation highlighting some key takeaways and updates from the rural New Mexico study that they conducted earlier this year. And then we'll take a little break and come back on some very timely updates from the New Mexico Healthcare Authority on Medicaid, Medicare, SNAP benefits, affordable health insurance, and of course, federal updates from New Mexico Congressional Delegate Senator Ben Lujan's office. And we'll go into some next steps and some save the dates, key events for next year, 2026. So who's in the room, my friends? This is a quick little snapshot. 242 CCF members and new members registered for today. Currently in Zoom, we have 162 and counting. Of course, huge representation from community members across general public, community coalitions, county and tribal health councils, nonprofits, of course, our state agency partners, for-profit legislators, tribal partners and tribal leadership, other sectors, philanthropy sectors. We're glad that you're here today, and higher education. You can see how multi-sectoral this convening representation is, and it's great because we each have a piece to bring to the puzzle of how we're going to come together and collaborate to serve communities effectively, especially during these times as we navigate these times together. And just we want to give a shout out to recognition to our state officials who are here today. A list of all of them, just for the sake of time. County and tribal officials, of course, county and city officials, legislative directors, state agency partners, our congressional delegates are here with us today, and tribal representation, of course, both on the leadership side, state, tribes, nations, and pueblos, and the nonprofit sector, tribal services as well. We welcome you. Thank you all for being here. And we're going to kick off with the closed loop referral system from the New Mexico Healthcare Authority. This has been a evolving body of work for years. We have our friends, Roberto Martinez, who's the program manager for the statewide closed loop referral system, here with us today. And of course, LaDawn Woodson at the Healthcare Authority, who is the Interagency Program Innovation Lead. So we're really, really excited to hear about the evolution of the closed loop referral system. Where are there points of engagement and collaboration, right? So that it's interoperable and there's no wrong door for our community members. So welcome, Roberto and LaDawn. If we can spotlight them, Sam, so they can say hi and introduce themselves.
Well, thanks so much, Valeria, for the introduction. And thanks, everyone, for being here and willing to share some thoughts with one another. Before I move forward, I think one of the main goals is really, hopefully, that one of the outcomes of this presentation is that you feel comfortable reaching out to both LaDawn and myself. So I think one of the biggest pieces is to getting to know each other. And LaDawn, I'll pass it on to you so that you can introduce yourself. Tell us a little bit about a story. I know that we have, Valeria, we're keeping our time within the time frame you gave us, but it'd be important for people to get to know you, LaDawn. So please go ahead.
So good morning, everyone. It is great to be here. Thank you for this opportunity to come before you. Again, my name is LaDawn Woodson. I am with the Healthcare Authority. I work alongside Roberto Martinez on this closed loop referral program, which we call Yes, New Mexico Connect. And we're just excited to be here. We are looking forward to collaborating with as many of you as possible to try to realize a vision of a system that can help benefit all New Mexicans. I am one of those people, like the Lieutenant Governor said, who grew up on food stamps, who grew up in public assistance, who grew up needing resources and not always finding them. And so this is an opportunity for us to do something great for the people of New Mexico if we work together as a coalition, connected and trying to accomplish great things. So thank you for your time, and I look forward to hearing back from you.
Thanks so much, Ladon. And I really encourage you, please get to know Ladon. As you can hear just a little bit from that story, a person who is providing strategy and leadership for this program is actually someone who has been in the trenches working with communities, as well as looking for the services himself. And I think that's really important because it changes the way in which we do things. So just highly encourage you to get to know Ladon, amazing human. Please connect with him and me as well as we move forward too. Let me share my screen briefly. So, and let me know if you can see my screen in presentation mode.
Looks great.
Awesome. Thank you, Sam. So what are we talking about? We're speaking about Yes New Mexico Connect, which we hopefully are building a network of support for everyone. I'm not going to go through these slides for the sake of time, but I did want to stop in this one. I am so glad we did the land acknowledgement, and I'm not going to read the land acknowledgement on our behalf right now, but I just want to show this mural that is, as you can see on the address there, like in the area of Gallup. And to me, it's beautiful to see not only the art, the colors, but if you look at the images, the many resources, the many ways in which tribal communities enrich our like current context. And wow, how much do we need that? So I just want to acknowledge that. And in addition, of course, to lend my own acknowledgement in support of the one that the Alliance has just recently done. So thank you, tribal communities, for really engaging with us too as well. So this is the outline of this presentation. We're going to speak about the what is the Yes New Mexico Connect. So what? What are we going to accomplish with it? And now what? How can we engage with one another, right? Simple 3 questions. And I love how actually Ladon starts these conversations. He helped us by envisioning this. Think about one of your clients. Maybe you're a care coordinator or you're at an organization, part of the health councils or part of the ECCD alliances, right? A person comes to you. This woman that you are seeing here actually has lost her job right now. She's trying to actually find housing as well. And as she comes to a care coordinator or a physician or someone who can support her, we can all agree that her needs at this moment are beyond health, are actually to look at all the services that she really needs to be able to not only survive, but have a high quality of life for her and her family. However, the challenge that we are right now trying to face is the fact that we know how hard it is to find the right resources for you and your family across New Mexico. Now, it is important to recognize that within New Mexico, there are organizations that have done this work prior to the Yes New Mexico Connect. Santa Fe Connect is one of those county-wide examples that we want to recognize, and we want to thank as well because we are really learning from their experience. Albuquerque is also joining in this effort. Doña Ana County is joining, and many other communities too are trying to join in to ensure that then we can build this solution, which is an ecosystem. And I want to point out here the word ecosystem. It's not just about the platform that I'm going to be able to share with you in just a second, but it's really about the relationships, the communication that need to exist within each of our organizations and the trust that needs to exist so that we can refer clients to one another and hopefully help solve the needs of the population in New Mexico. So as we think about developing Yes New Mexico Connect and releasing it, there are 3 strategies, right? The first one is we need to configure, deploy, and promote the platform, which I will show you in a couple of slides right now. What does that means? Being ready to use it, right? As organizations. And then once we are ready to be able to promote that to individuals across New Mexico. The second strategy is, well, how do we integrate the CLRS, Yes New Mexico Connect, into the healthcare system, behavioral health as well as primary care, so that health-related social needs can be integrated. And typical integration frameworks help us or guide us to think that to integrate all of this, behavioral health, primary care, health-related social needs, they all have to be in one place, in one physical location. Well, we know that that's a challenge for New Mexicans when we have a shortage on providers of all kinds of providers, right? So given our context, how do we integrate this work? That's one of the strategies that we are addressing. And then finally, well, we need to make sure that there are services, particularly if you live in the rural areas. You don't want to refer someone 90 miles away so that they can, for the next 2-3 hours, drive, if they have transportation, to the services that they need. But how can we together think about some degree of alignment to, once we add numbers to what we know anecdotally in terms of the needs of gaps in services, how can we then foster some policy and financial alignment to fill in the gaps? Yes, New Mexico, this is the statewide closed loop referral system. If you go to yesnewmexico.org, you will be able to see what I'm showing you. And as you scroll down on the page, you could get to what we call this board, meaning Yes New Mexico Connect. If you click on Yes New Mexico Connect, it's going to take you to the actual platform. I want to invite you to as well to sign in and to be able to create accounts. If you create accounts in Yes New Mexico, those same accounts can be created, can be used in Yes New Mexico Connect. It's integrated already, so you don't have to create 2 accounts in that sense. But once you click on that link, it's going to take you to this, which is the platform Yes New Mexico Connect, powered by Find Help. You will be able to enter a zip code in the search, and then we'll be able to take you to this, a platform where it shows you, for that zip code in particular, what are the programs around. And you can see all the categories here in terms of food, housing, goods, transit, health, money, etc. Once you click in one of the categories, for example, I clicked on this, clicked on the housing piece, you'll see this resource center, and below it, you'll see a whole other list of programs. What it's going to happen then is, if I am a care coordinator or if I'm a navigator, I will be able then to, for example, refer someone to the resource center, and the resource center is going to be able to understand, welcome the client, and then close the loop by going into the system and marking whether the person received the help or not, allowing us then to understand whether people are being helped or not, right? So where are we in this process? You know, we come from this big idea of like, how can we refer to one another more seamlessly? How can we make it easier for like people to access? But we, in this roadmap, are at number 4. That's building the network. So before we are able to start advertising this to individuals, before we are able to start referring, we need to ensure that as many organizations as possible are participating in the network. This means that they have been trained on a few things. One is going into the platform and claiming the program. Means these are my hours of operation, this is the service I provide, this is who I can provide a service to, etc. And then turn the switch on when they are ready to receive referrals through the platform. Right? Hopefully next year, sometime in the summer of next year, once we have grown the network to an extent, we can start speaking about a refinement phase, like identifying gaps, health screening alignment, interoperability, and more importantly, number 6. And I think that's going to depend, the timing of that is going to depend on the maturity of this project, gathering together to break down some of the barriers to drive outcomes. I just want to leave you with a couple of images. This is one. Imagine here on the right, counties. This is a hyper-local approach where counties can develop their networks, can like make sure that they have already like those relationships, and we just want to enhance that. And every county is welcome to participate in this program. On the left, you see tribal communities. We are inviting, and we are actually in the process of sending the tribal, the government-to-government letters, so that to follow that government-to-government relationship procedures, and invite all tribal communities to participate as well. But this image is telling you we have the ability of doing this hyper-locally at each county, and then also statewide. And in the middle, that's what you see, the organizations that serve the community like from like a statewide perspective as well. So hopefully in the end, this could be an interconnected network of organizations serving. This is a progress report in terms of, we launched this site in July 2025, so just very recently. Internally, we are already looking at some like training, some like programs, like for example, TANF is the first one. Agencies that are already participating are ALTSD and MDOH. ECCD, actually, we are starting to talk to them about that. CYFD and DWS are in the works. We have 12 counties that have decided to participate, 4 managed care organizations, the 211 community-based organizations offering, and 311 community-based organizations are already in the system that have claimed their programs, and about 320 referrals since July 2025. But that piece is yet not the one that we are really promoting. It's more ensuring that the network is growing and it's building. So what then? This is the next step. The goal is to grow the network. This is our approach to growing this network. We build relationships, and as we build relationships, we really look at the organizations deciding to participate, a role definition, and you can read that column there. And then once they decide to participate, we go into building skills with like the training piece. So all of this has to happen before we start promoting to individuals, which is what this graphic is telling you. We are trying to work with all of these organizations so that sometime Q1 or Q2 of next year, we are ready to start promoting to individuals as opposed to just on community-based organizations. This is the call to action, which is we have a training hub that we are going to start promoting, and we hope that as you all come to work with all the organizations, that you can invite them to go into these trainings so that they can learn about how to participate with Yes New Mexico Connect. So I see a couple of questions in the chat, and I just want to take an opportunity to address them. One of the questions is going to be about interoperability, right? So we know that there are other communities that are using other platforms besides the one that we have used. And I just want to, that the state has chosen. I want you to refer to this roadmap. And I want to point out interoperability. So the how is it going to work? We don't know the how is it going to work yet. That's one of the pieces that we are exploring from a data governance perspective, from a perspective on actual technology like interaction and integration. However, I just want to assure you that, as you can see here, it's part of the contract that we have with the vendor. It's also part of what we want, interoperability in the state, so that we can make it easier for organizations to participate. And however, as I've said in other meetings, in order to be able to have two systems work with one another, well, the two systems have to be stood up and running. So that's where we're focusing on right now, and getting it up and running so that then we can think about integration on that piece. And I want to also, Anna is asking in the chat, can we talk about any beta testing that has been done with Find Help, Yes New Mexico, and with who has that been on? So one of our pilot communities actually has been at the county level. It's Doña Ana County. And I think I don't want to speak about their experience. I think they should actually share their experience with you. But that's one of the pilot areas where we are starting. The benefit of that area is that Doña Ana Connect already has a network of organizations that have been working on. So far, the reports are very positive. Part of that network is there are primary care providers. Those primary care providers are already working to integrate that into their electronic medical records, which is going to be an essential piece to working with primary care providers. So, Anna, we could spend the whole meeting here speaking about that, like those pilots, but I want to make sure that you know that there are some already areas where this is being tested, and we are learning and trying to troubleshoot like whatever we are finding. And then the other piece is just currently did a pilot with them. And again, the reports are very, very promising as in terms of adoption. I know that we are close to my time, and I want to be respectful of other speakers. So I just want to finish with our email addresses. Please contact us and connect with us. We want to make sure that you feel comfortable doing that. And let me end by saying this. I remember when Valeria, about a couple of years ago, I was still working at NMDOH at the time, said, hey, Roberto, we need to ensure that these collaborators are talking to each other. And I'm so grateful that Valeria has taken on and the Alliance has taken on the role where I can see 150 participants today, where you are all sharing and trying to learn from one another. I hope that as we do that and build the relationship, which is the key word for this work, then we can continue enhancing your work. So thank you, Valeria. Thank you to the Alliance for all your work in this section. And I'll stop sharing here. And I'm not sure how much time would we have for questions, if any. And I want to be respectful again of your time.
Thank you, Roberto. Yeah, and thank you for being so responsive, because it was during the time I was landing and I was looking for like, where can we lean into right away, right? And connect with our local partners. So thank you for mobilizing on your end, right? To make those connections happen, that this CCF has been so critical for the last couple of years. We're going into our third year. I am in the belief that not only do we have the dedication and commitment in New Mexico, but we clearly have, the expertise, the resources, the willingness to partner so that we can be more effective at taking care of community members. And CLR is at the heart of that. Sharon M is at the heart of that. 211, Santa Fe Connect, Unite Us. There's so many partners. So it's amazing to see that mapping from local to systems, right? How we can all interconnect so that there's no wrong door for our community members, right? I think that's a shared value and commitment here. So let's open it up to some questions, my friends. I know you addressed, I think, Anna's question. There's Maria Elena says, how does NM Connect work with Unite Us? Did you touch on that already, Roberto? I think you may have. I don't know.
That was a question about interoperability. Yes.
Interoperability. And then Jessica Ossenberg said, if you can talk about where the planning is at towards potential reimbursement to organizations providing services.
That's an excellent question. Let me speak about what the spirit and the direction, like in terms of strategy, and then actual update on where we are at. So direction where we are going is hopefully, yes, we can reimburse for some of the services provided by organizations on that. There are a couple of examples in the state. One of the managed care organizations is already doing some of that, and we are trying to learn about it. Those learned lessons from that managed care organizations are also going to a work group that we have with managed care organizations, as we think that piece of how do we provide some financial incentives so that organizations, Jessica, is like, we're far from having a very clear answer on the incentives piece. I want to be transparent and I want to be honest about that. However, in direction-wise, that's where we're moving towards. And I wouldn't say we're inching toward it. I think actually we're moving quite fast in that direction to try to figure out what are those financial incentives at that level as well. And then we are exploring a couple of other areas. And if you think about the presentation, like that strategy, that's why counties are so important. Counties have relationships. You all have also a contract with the organizations. Agencies do. In the future, right now the call to action is very clear. Invite organizations to be trained so that they can be part of the network. That's the first call to action. But in the future, not too far away, in a year and a half, I think we can start talking about that alignment and start thinking about what's the process for that alignment. It's not going to take 1 day or 2. It's longer than that. It's hard work, and we have to acknowledge that it's a complex context. But that's the direction that we are moving in.
Oh, Roberto, are you still with us? It cut off. Maybe it's on my end.
Yes.
Yeah, okay, great. And then we have Anna, who is inquiring, saying, glad to hear the state has reports in terms of adoption from what sounds like current pilot efforts. Yes. What does the current pilot efforts, what does the state have in terms of reports on functionality, utility, and outcomes? It's important as the state to deeply understand how new operations are going to work and iron out any kind of kinks prior to launching, especially in light of previous efforts.
Absolutely. So the first piece to the answer is we need to make sure what is the outcome that we want to approach, right? And what do we want to achieve? What does success looks like? That's the first question that we have to answer to be able to look at data and make sense of data. Else data is just numbers and doesn't inform us in any way. So what we've done in that regards is we've developed in collaboration with the PRC, Prevention Research Center, Becky and Dr. Carey as well are helping us do that piece. Develop an initial logic model and framework for this initiative. Also, what we would call the theory of change, a process as to how change happens. We have shared that with different groups across the community. We are very thankful for the NMSDOHC, who's provided quite a bit of input, and 15 other groups that, like the PRC, helped us gather input from. Also internal from HCA, we've landed on a quote unquote almost final version of the. Now that we have that, we are looking at the evaluation plans and starting to look at data. I think as soon as Q2 of next year. We already have data. We have like a dashboard that Fine helps provide us with. And for sake of time, I'm not for you to know that the data already exists, but to make sense of the data, then we are going to have to look at that frame that we have developed already. And thank you, Sam, for turning my video. It seems that my connection is having some issues here.
It was a little choppy. Roberto, we like having eyes on you, but we want to hear you. So I think, and we can also respond in the chat in case, and LaDon, maybe you can help us with that on the Anna question. Roberto.
That's what I'm doing right now.
Thank you so much, my friend. We have Kim who's asking about, can you share the 12 counties who've expressed interest so far in participating in the hub, in the CLR hub?
Absolutely. And Valeria, I'm gonna have to look at my documents. So for the sake of time, I wrote
No
via
worries.
email.
And then from a community, Kim's sending you
It's
cards.
great to see your name though.
Yeah. And from a community perspective, like, is it the general public that's going to be accessing this system for an array of services? Or is it a focused population like Medicaid, Medicare? Can you talk a little bit about that?
Absolutely. So this system will be available to anybody across New Mexico.
Beautiful.
Medicaid, non-Medicaid, anybody who is in New Mexico can access that service right now. Now, just as a reminder, we are not yet promoting that service to individuals. We need your help so that to make sure that organizations are ready to receive referrals. And that's the work that we are doing now. Just plug in for the call to action. Join us in our trainings. We'll send you a link so that you can start participating in those trainings and share that link with as many organizations as you can.
Yeah. Beautiful. And of course, if the contact information, Michael Martinez it's on the slide deck, and we'll be sharing the recording and the slide deck with all of you. Of course, Roberto, I believe you're on the CCF Hub. You can also share these calls to action via the CCF Hub. You can put your contact information. Oh, you already did. Thank you. Thank you, Roberto. Thank you, Michael. We have a couple more minutes. Any other questions before we continue with the agenda? It says it would be helpful if the state could fund one person per county to get the resources in. It's a lot of work. Indeed, it is. Carrie Moore from Chavez County. I mean, just on the share, I'm glad you brought that up, because just on the share New Mexico, which offers over 14,000 resources and services statewide, it's taking, years to build that network and that resource. And it takes, you're right, Carrie, people to continue to sustain and validate and outreach at the local level. So,
Valeria,
Roberto, what are your thoughts around the Carrie Moore questions from the county side?
I totally agree with you.
Yeah.
We need people to do this, right? So where do we start though to get there? We start by talking to the systems that currently are serving New Mexico. We are not here to replace any system. We are already in conversations with Valeria, as to the role of Share New Mexico. We want to support their work as opposed to replace their work. That's not what we're here. We're also already in conversations with the 211s. How can we enhance their work as opposed to replacing their work? So first step, we work with all those partners to collectively decide what works. Then we are looking at some staffing models as well, potentially through community health workers. More to come in that end. But I think what's important for you to hear is direction-wise, we are looking in the same direction. We need people to do this work. It cannot be done in a vacuum. And we are thinking in that direction too.
Beautiful. We're with you, Roberto and LaDon and CLR. Yes, and thank you so much. We don't see any more questions, and we're right on time. So really appreciate all the time and effort, Roberto and LaDon, in presenting on CLR. And then next we have, and you'll have the contact information, you have the slide deck, the recording by early next week and on the hub. Next we have Rosalinda.
Hi everyone, my name is Rosalind Smith. I'm the policy analyst with the Behavioral Health Services Division at the Healthcare Authority. And I'm here to help just give an update on everything SB3 related. Let me go ahead and share my screen. Can everyone see that okay? Great. So Christy Gross is our Director of Behavioral Health Transformation and Innovation here at the Healthcare Authority. She was going to present with you all today. Unfortunately, she did have to go attend to a last minute family emergency. So that's what her name is, but I'm Rosalind Smith and happy to step in. So just as a quick reminder, Senate Bill 3, the Behavioral Health Reform and Investment Act, was passed this past legislative session in 2020.
Rosalinda, I'm so sorry to interrupt. I don't know if it's just on my end, but just want to check because we have translation services as well. Can everyone hear clearly? Just there's a little echo, so no.
There's an
Rosalinda,
echo.
do you have headphones?
This better if I do it like this? Better?
Yes.
Okay, wonderful.
You are sharp and clear. Thank you.
Perfect. Yeah, thanks for saying something. All right. So Senate Bill 3, the Behavioral Health and Reform and Investment Act, it passed this past legislative session. And through Senate Bill 3, it really takes a regional approach to behavioral health care. It involves all three branches of the government and it involves stakeholders to help identify 5 priorities within each region. And each region is able to develop a plan for 4-year funding. So it really calls into really everyone within the state to help just provide input, create these regional plans. It's really asked for everyone to work together to consider the expansion of behavioral health care in New Mexico. Senate Bill 1 and House Bill 2 were also passed this last legislative session, and they help address the financial components of SB 3. I'm not going to talk too much about Senate Bill 1. That bill created a trust fund for long-term behavioral health care. But House Bill 2, I might touch on a little bit later on these slides. So just important to note that those are 2 other bills that just help provide the financial support for the Behavioral Health Reform and Investment Act. Beyond regional planning, some other key highlights in Senate Bill 3 are also that it establishes what's called the Behavioral Health Executive Committee. I'm going to talk about that in just a moment. It also calls for the use of SIM mapping to develop the regional plans. So SIM mapping is a tool that really looks at identifying gaps in care and resources that are available throughout the state. And so we're using that as a resource as we consider the development of regional plans. Senate Bill 3 also highlights just the quality of service standards that we ask our providers to meet within the state. It also develops a universal provider enrollment and credentialing system. So that is another key aspect of this bill that we're working on and looking at, as well as the integration and coordination of 988 and 911 systems.
Sorry to interrupt you. Is there a way to change it to presenter mode, just so it's a little bigger?
Yeah.
Thank you.
How do I do that?
Or Sam, you can switch over to our master deck because I think we have all the same slides, which would be easier to support Rosalind.
Here.
I can, yes. I just know she had a few different ones.
I had a few last minute updates, but let me
Got
try
it. Thank you.
this. No. Is that better? Not better? Okay. So we were talking about the Behavioral Health Executive Committee. So this committee is comprised of the following: Carrie Armijo, our Cabinet Secretary for the Healthcare Authority, Director Nick Bucas, who is the Director of Behavioral Health Services Division, BHSD, and he also serves as the Executive Chair for the Behavioral Health Executive Committee. Dana Flannery, who's our Director of Medicaid Services, Carl Reinsteck, who's our Director of the Administrative Office of the Courts. And then the Administrative Office of the Courts, per this legislation, also had the ability to appoint 3 behavioral health experts within the state. And so that is Dr. Stacy Cox, Dr. Violet Cloud, and Jerry Ortiz Ipino, who are also helping serve on this Behavioral Health Executive Committee board. This board meets at least quarterly. These are public meetings, and so everyone is invited to attend these meetings or to listen in. This committee also reports quarterly to the Legislative Finance Committee, just with a status update on regional planning and the development and implementation of this bill. This committee designated behavioral health regions. We'll talk about that in a moment. We kind of already mentioned regions. They also review and approve regional plans, establish funding strategies for these regions to go forth and do the great work of their priorities that they identify. We monitor and track deliverables and then also address any deficiencies and implementation issues that might come up with the development of these regional plans. So February 27th was the date that this bill was signed. On June 1st, the Behavioral Health Service Division and the Legislative Finance Committee developed an evaluation guidelines that are now published on our website, as well as service standards that we help hold. These are resources for the regional plans as they further develop. The Executive Committee on June 24th met for the first time, and that is when they voted on the regional plan, on the regions that were established. We're going to talk about a couple of these other highlights that you see here, including August 18th with the Administrative Office of the Courts announcing a funding opportunity. And then just this week, BHSD also announced a funding opportunity. Some other highlights that aren't necessarily date specific are just that we have already begun working with SIM mapping with regions throughout the state. We've begun discussions and are getting ready to soon support our regional plan meetings. There's been a lot of presentations, conferences that us as well as AOC have attended. We're really trying to get everywhere we can throughout the state to help listen to folks and just hear what questions, concerns, and also what excitement there is for thinking about the development of our regional planning. We've been working, and we'll talk about this too, but we've been working on developing a rubric for how we will be evaluating these regional plans and also a funding formula for how we'll be funding them. So as mentioned, on June 24th, when the Behavioral Health Executive Committee met for the first time, they voted on the 13 regions. These regions mirror the judicial districts throughout the state. You'll see them here on the map with a little green highlight where there are tribes, nations, and pueblos as well. Per Senate Bill 3, a regional plan is defined as a plan that is developed collaboratively by behavioral health stakeholders to provide behavioral health services within each region. And so again, just really highlighting that this is a community effort. We're really looking at everyone from providers to recipients of behavioral health services and everyone in between to help just provide input into what goes into these regional plans. The Administrative Office of the Courts on August 18th, they announced a funding opportunity to provide $60,000 for each behavioral health region in order to help support the development of these plans. The Administrative Office of the Courts is beginning to help define dates for regions to begin meeting, and they're working with the University of New Mexico to help put on these workshops so the plans can become developed. And so the Healthcare Authority, we're really just supporting the Administrative Office of the Courts, trying to raise their voice in the great work that they're doing. The University of New Mexico Health Sciences Center is also working closely with AOC as well as ourselves, the Healthcare Authority, to develop an integrated mapping structure for youth and children as well as adults. So they're really helping support our efforts with that required SIM mapping that will be used as a tool when we continue to develop these regional plans. The Healthcare Authority is further working to develop a rubric. This rubric on the far right side here, you can see just a little snippet of the draft of this rubric. And so this rubric, while it's in the final stages of its draft development, it will be published soon. This is how we are reviewing the regional plans that each region is submitting. So working closely to help provide this with the Administrative Office of the Courts as they get ready to put on these workshops for each region. This rubric, it's really a standardized framework for just helping ensure consistency and alignment with what is required within Senate Bill 3, as well as, just making sure that each regional proposal meets the needs of our behavioral health service standards and the evaluation guidelines set forth. The Healthcare Authority has also been working on putting together a funding formula. This is a very draft funding formula. The weights of these rationales and categories may change, so I just want to say that up front. But we've been working to identify a funding formula so that the Behavioral Health Executive Committee has a way for determining how regions will be funded based on the priorities they set forth within their plans, as well as what is needed throughout the state. So you'll see on the far left, the categories that we're looking at are first, just an equal base allocation. So each region will receive a certain percentage of a base allocation for their funding. But we're also looking at, of course, population needs and what the service gaps are within each region, as well as those who may be disproportionately impacted. Again, this is still a draft, so you're just kind of getting a view of what is to come. Just want to note that the Healthcare Authority has also scheduled tribal consultation to occur on December 2nd. And so this funding formula may also change based on what occurs through that tribal consultation. I don't have a slide on this, but I just want to note that through the appropriations that were provided in House Bill 2, again, just going back to our bills that were supporting the funding for Senate Bill 3, $50 million is set to expire at the end of fiscal year 2027. And so with that in mind, and the $50 million is not the only appropriation that is for Senate Bill 3. It's just one line item. But noting that it's due to expire at the end of fiscal year 2027, and also noting how there are current immediate critical health needs for behavioral health services within the state, this past Tuesday, on November 3rd, the Healthcare Authority, we issued a notice of funding opportunity for early access regional plans. And so through this notice of funding, each region that we saw identified has the opportunity to submit a request for early access funding set by one of these 4 critical shortage areas that the Healthcare Authority has identified as an immediate need within the state. And so these 4 critical shortage priority areas are residential treatment care, the crisis continuum of care, medication-assisted treatment, or MAT, for justice-involved individuals, as well as prenatal and perinatal substance use disorder treatment programs. Regions are eligible to apply for funding that supports projects that cover one of these areas or multiple. So a region may say, we have 3 counties within our region and each county has a different critical access need. That's okay. We're just really here to help support the immediate needs within each region and across our state. The total amount of funding that we are announcing is 26 million statewide, or about 2 million per region. We are asking that applicants submit their applications by December 19th. We know this is a really quick turnaround, but we really want to make sure that we get money out the door for critical access needs as soon as possible, because these are emergent needs across our state. Early access regional plans will be incorporated into the final regional plan for each region. And eligible applicants are any behavioral health region that has already applied for the AOC regional plan fund. So that 60,000 that we talked about, AOC has opened up applications for funding for. Any region that has applied for that may apply for this funding as well. And I'll just say as well that we know 12 out of the 13 states have already applied. So that pretty much leaves almost every region is eligible for this early access funding. We've also, like I said, we've been all across the state trying to share the good word of SB3. We really just want to continue to ensure accessibility and transparency across the state, both with us as well as the work we're doing with the Administrative Office of the Courts. Of course, we welcome all feedback, questions, communication. We have this beautiful email where we're trying to share this wide and far, so folks can reach out to us there at bhriasupport@hca.nm.gov. You also see on the right-hand side, we have a little snippet of our website, but our website's where we've been keeping everything up to date. The Behavioral Health Executive Committee meetings, as I mentioned, they're public meetings, so you can find information on how to join those calls through our website. We include the Zoom link and information. Our next meeting is scheduled for next Wednesday, the 12th, and so folks are invited to listen in on that as well. And then lastly, just wanted to talk on next steps for Senate Bill 3. There's a lot we shared here and a lot of work that we're doing right now in the moment. I mentioned that we are also excited to conduct tribal consultation on December 2nd. So that's something we're really looking forward to. We're continuing to work with the Administrative Office of the Courts, who is leading the way with these SIM and eSIM workshops as they kind of work with regions to develop their regional plans. The Behavioral Health Executive Committee, as well as the Healthcare Authority, is excited to review early access regional plans. So those that come in by December 19th. We're also excited to finalize our funding formula and then be able to release that, as well as our rubric, finalizing the draft of our rubric and publishing that on our website as well. And then just continuing to provide technical assistance and go out into the community and speak and hear what folks are interested in and where folks think there is further behavioral health needs across the state. And I know that was a lot. That's all I have for now, but happy to help answer questions.
Yes, Rosalinda, thank you for the timely updates. And we have quite a few questions, starting with Joyce.
Yeah.
Is there a timeline for the SIM mapping? The only thing I'm sure of is that it's done by region. Yes. Is there a timeline for the SIM mapping?
Yeah, great question. It's different based on region by region. I would highly suggest going, and I can even put it in the chat here, but the Administrative Office of the Courts has a timeline for regional planning. I know that a couple regions are looking at their workshops and finalizing their SIM and eSIM mapping by the end of this calendar year, so coming up here really soon. A couple others are scheduled for early next year. But yeah, just really encourage folks to go to the Administrative Office of the Courts for further information on that.
Beautiful. And Sam will plug in the Administration of the Courts SB3 info page as well in the chat, so you all have access to it. And the next question is from, I'm scrolling. So regarding the funding, which we included the link, thank you so much for that timely update. Lacey asks, is this funding to individual providers or to the fiscal agents for each of the regions?
Oh, great question. So each region will have an identified accountable entity. That identified accountable entity will act as the fiscal agent. And so the idea really is for regions to tell us, the state, what their needs are. And so the accountable entity will be the applicant as well as the fiscal agent, and then through there, providers can be funded based on projects that are identified within each regional plan or projects that are identified within each early access regional plan.
Beautiful. Does that satisfy your question, Lacey? Yes, thumbs up. Samantha Winter from Scope, Socorro. Would you like to ask your question, honey? Just because I want to make sure it's conveyed clearly. I don't want to mess it up.
Yeah, sure. So we basically had a question kind of about the early funding in our region. There was a little bit of confusion. If we apply as a region for the early funding, would that come out of essentially these final awards that are looking kind of after we complete some of the plans later in the spring, or is this essentially extra money kind of on top of that? Because we're trying to decide essentially, should we kind of come up with a quick plan to kind of get us through, or should we just focus all our efforts on doing some of the later work and do a bigger plan later?
Yeah, great question. So the early access regional plans, that early access priority or priorities, as you will, is separate from the 5 identified regional priorities. So we are asking that regions, if they do apply for early access regional funding, please do incorporate that into your larger plan, but that is separate from the 5 identified priorities that will go into the larger regional plan. Makes sense.
Samantha, is that clear?
Yeah, sorry, I was trying to do the reaction buttons and I couldn't get it to work. Yes, that works. Thank you.
Beautiful. And thank you so much. And thank you, Maria, for including in the chat, my friends. She's included the upcoming November 12th SB3 Executive Committee meeting that happens at the state capitol, November 12th from 9 a.m. to 11:15. It's also accessible via Zoom. So when you go to nmlegis.gov, you can go to the webcast and access that committee meeting via their webcast Zoom as well. And thank you, Geraldine. She's included the BRIA support at hca.nm.gov email. As Rosalind has asked, feel free to make inquiries, ask questions. We have our friends from Healthcare Authority responding promptly. Our friend Hector is asking, the funding in 4 areas, specifically residential treatments, is this for adolescents or adults or both?
Oh, great question. So again, we're asking regions to let us know what their needs are. But this is across lifespan. And so if a region determines that, our critical access needs is really with youth specific, then they'll let us know. We don't want to make that determination, but it is open across lifespan. And so, yeah.
Beautiful. I hope that satisfies your question, Hector. We also have Lisa Hampton. Hector gives us thumbs up. County of Los Alamos did the SIM mapping as part of Region 1 back in June, and a report was issued. Are we required to do this again as part of SB3?
Great question. I don't know that I have the executive answer on that, but I would say I would just strongly encourage to work with the Administrative Office of the Courts in kind of that discussion and and determining if another SIM mapping is required or not.
Beautiful. And I do see you, Browning. Let me just get through. Okay, I think this is go ahead, Browning. I see your hands up.
Yeah, sorry, I'm just going to go back to a previous question. So is the funding for early access from the same pot as regional planning dollars? Meaning, like, are we getting, I understand it's a different priority, But if we focus on early access, like if we do an early access, are we losing then money towards a larger regional plan? I guess like in my question is, those pots were sort of predetermined, and let's just say that none of those pots were really what came up in the region as something that needed more immediate focus. So, and also all of the work that's happening towards regional planning and the amount of work that's going to have to go into this early access. Is the money different, meaning money additional, or is the money the same? And so if you don't do early access, you lose money towards that full regional plan.
Yeah, great question. And I'm trying to think of how I want to answer this, because it's not as clear as I wish it could be. Because there are various different lines of funding. But this early access funding is not necessarily from the same pot. This is funding that expires at the end of fiscal year 2027. So I don't know that necessarily though means that a region may lose funding if they don't apply for the early access, but I would strongly encourage them to apply for early access if they can, and if there is an identified need for critical access care within each region.
Right. I guess because the regional, like the complete regional plans are due by the end of fiscal year 26, meaning that they would then be funded for fiscal year 27. So yes, that money is going to revert after 27, but regional plan, like a complete regional plan, should be funded by fiscal year 27. So I guess we're saying that 50 million in reverted funds for after is all the same money.
Yes, that's true. Yeah.
Thank you. Great question. So we're right at time, my friends. Any other reflections, questions, concerns that folks want to chime in on the chat, or if you want to raise your hand? And if we're feeling complete, if you can give me a little thumbs up so we can continue. Maria says, thank you. Thank you so much. Rosalind, this was incredibly helpful to get these timely updates. Lots of thumbs up for Healthcare Authority. And on that note, thank you, Rosalind, and thank you for sharing all the critical information. On that note, I wanted to share with our partners here that the Alliance is working closely with AOC and other partners, obviously, in supporting all 13 reaching out to you all as we do local outreach to make sure we have as much local diverse representation at each of these community listening sessions, which of course, will inform this planning process and SB3 priorities and all of that. So just wanted to give that update. And next we have, thank you, Rosalind, and thank you to our friends at the Healthcare Authority. We have the New Mexico Department of Transportation, Deborah Bach, Rural Transit Programs Manager at NM Department of Transportation, and of course our friend Meredith Green, who are going to provide us with an update on a 2025 rural transportation study. Did I do justice to you all, Meredith? So over to you. Thank you for being here.
All right. Can you go back a couple slides to start on our title slide? Or should I share my screen?
Sorry, this is the first slide that I have.
That is very strange. It's okay. We'll make it work. And then if we need to cue next slide, do we just tell you all to do that?
Sam is there to cue you into the next.
Amazing. Okay. Thanks. Okay. Deborah, would you like to go ahead and start with this slide?
Sure. Thank you for inviting us, everybody. Sorry, I'm unable. I don't have a camera today, so you'll just have to remember me by my picture. the New Mexico Department of Transportation, the Transit Bureau is the specific bureau that I'm part of. I oversee the rural programs across the state. So the Federal Transit Administration dollars come in through the governor's office, and then we distribute them across the state for rural transit projects. And in 2019, we put together a project plan under a discretionary grant, HOPE. It was a federally funded grant because we realized that in the Gallup region of our state, we had 3 different transit agencies, the Pueblo of Zuni, Navajo Nation, and the city of Gallup, providing duplicate transportation in and around the city, that there were there was not a transfer facility, there were no transfer points that were that provided shelter or bus stops. So we put together a plan to examine the existing conditions, to look at the community profiles and the service profiles of all 3 transit agencies involved, to put together a plan to look at walking profiles, make recommendations. And we submitted this grant and we were awarded. Unfortunately, COVID hit, so we weren't really able to start the project until almost 2023. Next slide, please. So once we were awarded the project, the original purpose of the project was to conduct a feasibility and site selection study for a transfer facility in the city of Gallup. So the Pueblo of Zuni and Navajo Nation, both areas converge in the city of Gallup for education needs, employment, healthcare, shopping, recreation. So we wanted to make sure that we developed a plan for service coordination and expansion, so that the services that were provided once they got into the city of Gallup would serve the needs of all 3, and then branch out further, maybe take the train, catch the Greyhound bus to Albuquerque, and then branch out to the rest of the inner city bus connections. We also wanted to establish public transit data and general transit feed specification for all 3. So all 3 would be mapped and available for to be on an app, and therefore we are conducting an intelligent transportation system assessment for all of the buses. So I'm just going to go really quick through our project goals. So our goals actually evolved over time. So once COVID hit and we realized the gaps in service for the citizens of those areas to reach adequate health care, just to get to shopping during COVID, or getting any type of essential service, sort of changed our goals in a lot of ways, but in good ways. So under the service revisions and stop enhancements, we were looking at Gallup as a hub, just one big system, but a good coordinated system. We're looking at revising the routes and the maps with the service providers, so there's no duplication, there's no overlap, and it's efficient. It runs according to the times that the workers are going to and from the casinos. It coordinates with healthcare providers and the times that the individuals need to get to and from their appointments. So we're making schedule revisions. We're looking at accessibility, amenities in and around the city, bus stops, walkability, and actually safety became a big priority for us during our examination of this area. And we hadn't initially thought about that. We're looking at signage, visibility, intercity connections, as I mentioned. And when we're thinking about a transfer facility, we don't necessarily want to build a new building. We prefer to use an existing facility with the existing infrastructure, maybe just renovate. And we're also looking to better utilize the fleets that are already in existence with all three systems. And part of our plan is also to make budget revisions and look at ways that we can have potential savings. Next slide, please. Under the fare collection and technology integration, so this is really important to make sure that we're coordinating schedules, we're coordinating policies, right? Fare box policies, transfer policies, the how do you get a pass? Where do I transfer? Is it the same price to transfer between all three systems? And we wanted to coordinate the ITS needs assessment so that every system has the same fare collection hardware and software. They have the same automatic vehicle location system. Real-time bus information is consistent. We can count passengers. And there's also, we're coordinating a central dispatch with all three systems. Next. Our long-term goals would be to identify short-term transfer locations in the city until we do identify a site for the center. Because right now, transfer points in and around the city of Gallup are just at random parking lots, or, you know, depending on if there's street construction, it's at a corner somewhere, and it's outside. There's no seating, there's no shelter, there's no lighting, there's no security. So we're looking to identify locations across the city for that. We're also looking to review existing planning and grant documents. You know, we're looking to find local match funding. We're coordinating all of these ideas with the city of Gallup and identifying additional resources they may have to offer. We've put together a group of stakeholders involving tribal members, you know, just citizens, people from employment sector, people from the development sector, people from healthcare, education, and we're taking input from all of the stakeholders to make these decisions, including the site selection. And then eventually we're going to be conducting environmental studies once we do pick a site. Meredith?
All right, thanks, Deborah. I'm going to talk to you all about the transportation providers involved in this specific project, and then we'll talk about other things going on throughout the state. Next slide, please. So as a part of our HOPE project, where we're coordinating transportation needs within the region, for all of the citizens of the area, including our tribal citizens. The providers include Gallup Rural Transit, which is essentially Gallup Express. They are the main provider throughout the city of Gallup. It includes Navajo Transit System. As you all are probably aware, Navajo Nation is one of the largest tribes, the largest tribe in the United States. And they have their own transit system, and it covers a vast area. So as you can imagine, it's not just New Mexico we're talking about, it's also throughout Arizona. So it's essential that as we move through this project, we help coordinate their services in and around the Gallup region for efficiency and cost savings. The great news is there is a possibility now that our planning friends over at Arizona are actually going to get involved and support Navajo Nation further with potential grant funding for planning services. So it's a super exciting place to be for this particular project. And then last but certainly not least is Ashwee Transit, and that's the Pueblo of Zuni. And they are small but mighty, quite the powerhouse, very forward thinking as far as public transportation provision is going. And they have a number of younger residents of the Pueblo that heavily rely on their services to access the college in Gallup. So as you can see, and as Deborah described, there's a great need to continue coordinating all of these services. So let's jump to the next slide, intercity bus service, and the slide after that. Deborah, do you want to introduce the intercity connections before I dive into the new route that we're looking at?
Sure. So the existing intercity connections in the Gallup region include Amtrak. They're actually operated out of this really beautiful historic rail station in Gallup. They have 2 daytime departures. It includes service between Los Angeles and Chicago with a stop in Albuquerque. The stop location, that stop location would be ideal for a transfer with a local transit, and then pick people up from the Amtrak, and then you get them into the central business district of Gallup for shopping, and then they can get to other destinations. The Greyhound bus system currently operates there. Unfortunately, their stop is located in a gas station off of the Interstate 40, 5 miles outside of town, right? There's 4 daily departures. It does offer service between LA and Oklahoma City with a stop in Albuquerque. But this stop location is not really ideal for transfers with local transit.
Promotion, meaning there's no promotion.
There's no shelter for them.
Apologies, Deborah.
That's okay.
Yeah, just to our friends, let's make sure we all stay mute so we can hear Deborah. Thank you.
Yep. So go ahead, Meredith, you're next. Next slide, please.
I just realized I accidentally got muted. Okay. So Greyhound is really working to not only kind of rebrand their service model and make a greater imprint just nationally, but really examine where service is being provided, how they can be a better partner, not only to local municipalities, tribal nations, but also presenting service, putting service together that actually works, right? Because we definitely want, as transit entities, to provide service that works for the people who need the service. Otherwise, there's no point. So the newest Greyhound route is actually from Albuquerque to Durango. Super exciting. It just launched at the beginning of October. Greyhound is also a conglomerate with Flixbus. So if you hear that reference throughout this next section of the presentation, I just didn't want you to be confused. But so Greyhound wanted to launch this new route. Like I said, it launched in October, but then the question became, how are we best serving the rural areas along 550 in New Mexico, and in particular, our tribal citizens who need access to hubs for medical services, for shopping, and the like, as including education. And so Greyhound partnered with New Mexico DOT to launch this new route. And when we were originally looking at possible stop locations, it got a little complicated because there was just conjecture and discussion, right? So we look at Bernalillo, Nageezi, Cuba. I'm trying to go through Bloomfield, Aztec, Farmington, and I know I'm forgetting one. So Deborah, you can chime in if I'm forgetting. I'm trying to remember what the other one was, but essentially some of these areas were highly rural. And when we start doing a stop analysis, typically what we would do as a transit planner is look at full demographics. So we'd say, okay, what percentage of the population within these census blocks are low income? What percentage of the households have zero vehicles? What about older adults, individuals with disabilities? And so we look at all those factors when we are traditionally planning transportation service. However, there are areas of New Mexico, as you know, that are highly rural. And it made that type of analysis very difficult for us to plan out what type of service was needed. So we, for the first time ever, started doing what is called a tapestry analysis. And it's this really new, interesting way that we can look at highly rural areas of New Mexico, and particularly on tribal areas as well, to determine what the needs are for that particular area. So if you'll go to the next slide, I'll kind of talk through what that looks like. So here is Nageezi. And again, it's one of our examples of tribal plus highly rural. And one of the things that we were looking at, you'll see the main highway through here is 550. And the question is, where should we place a stop where if I don't have a vehicle, I can safely walk to the Greyhound bus stop and not have to worry about pedestrian fatalities? And I'll mention the stats for pedestrian fatalities here and later in our presentation. But here we did a buffer. So if we do a stop at the middle of that little orange blob there, the walking distance from the middle of that orange blob, so to speak, is 0.25. So it's a quarter mile. So at any point there, I would walk a quarter mile. The green buffer shows a half mile, and then the blue buffer shows a full mile. So those are walking distances to a proposed stop. Why does this even matter? Well, let me show you what the tapestry analysis does. Next slide. So taking that orange blob that you saw on the previous slide, you can see it here listed as a central stopping point there for Nageezi. And from that area, we can drill down now and look at how many households are there, what is their median age, what's their income. We can divide it down by diversity index, which obviously here it's 100% by US Census American Indian. So it tells us who we're serving within that range and if that is capturing our full target population. So I'm not going to go through every single one of those buffer zones, but this is an example. So what we did was take every single one of those buffer zones at a quarter mile, a half mile, and a full mile, and did a full tapestry profile for every single one of those. So we could see, are we capturing the right audience for this service, and is the stop in the right location? Next slide. So here, drilling down just in that buffer zone, we can even go even further to look at educational attainment, occupation types, and then the unemployment rate. Next slide. We also have an age pyramid. So you saw that the average age in that orange blob, for lack of a better term, was around early 40s. But here we can see, do we have older adults? Do we have younger people? And so that is all part of the age pyramid as well as household income. Next slide. And then here we have some additional factors like home value, scenic byways. And so those segment values are reflective of the entire US. And so we can kind of see and compare what, service factors we're providing. Next slide. So all of those taken into place, we did a tapestry analysis for every single one of the proposed stops for the Greyhound new service. And that is actually telling us how successful the service could potentially be, and are we serving the populations that need it most. And the great news is, outside of the Bernalillo stop, the service has taken off and the ridership is great. We even heard an anecdote yesterday about how the veterans in Farmington once had to go through a veteran service provider that was contracted out to a private provider, and they were paying like close to $200 just to go to Albuquerque so they could get their services at the VA in Albuquerque. And now with the Greyhound route, that cost is reduced to only $50. And so while it is still a cost, it's significantly less than what they were paying through the private contractor. So that level of anecdote is huge. I want to talk next about major challenges. Next slide. So, and I know we're probably easing up on time here, maybe about 8 minutes. So I want to make sure I'm being cognizant of that. So public safety concerns. These are things that we take into consideration with all the transportation planning we are doing throughout New Mexico. Deborah will talk about some of the other projects we're doing here in a second. But in particular in the Gallup region, this is a huge concern. Pedestrian fatalities are increasing nationwide. Alcohol is often a major factor, particularly on tribal lands. And in New Mexico, nearly 20% of the total fatalities were pedestrians. There are some stats there for McKinley County specifically, which is where HOPE project is occurring. And so we have some information from 2020. But let me lay out these statistics for you because Deborah and I just presented at the New Mexico Safety Summit, and I think they're significant. Pedestrian fatalities in the entire United States are about 2.33% per 100,000 people. In the state of New Mexico, pedestrian fatalities are 4.97% out of 100,000, so nearly double that of the national average. And then on tribal lands, we're looking at like 6.93%, so triple of the national average. And this is a grave concern because a number of tribal citizens do walk to the destinations that they need to get to. There is not safe infrastructure. There is not safe lighting. It's often along highways. And then, of course, there are other tribes who culturally believe in running and walking. And so when we're looking at improving safety throughout the state, and in particular on tribal lands, it is important to consider not only the cultural needs of each individual tribe, but the fact that there just is very lacking in infrastructure. And so that's one of the things that we're considering with these projects. So Deborah mentioned the walk study that we're doing in the Gallup region. That's something that we will be able to use to make recommendations on safety improvements in that area. Next slide. This is specific to McKinley County, but they actually, in the state of New Mexico, they were identified as having the highest rate of pedestrian deaths. So you can imagine why that walk study is super critical. Their rate is approximated at 18 pedestrian deaths per 100,000. And so there's a number of factors that are contributing to that. And then up on the top right corner, there is an article that is definitely worth a read called Dark Highways, Fast Cars, and Few Sidewalks. And then the picture below is actually from a gentleman's blog. He made a point of walking through the entire state of New Mexico to determine what that was like. So being cognizant that a number of individuals do walk to get to their destinations, he wanted to know what it was like. And so that was one of the pictures that he took there on the side of the road with no lights, no infrastructure, and the like. Next slide. And then lastly, before I turn it over to Deborah, or Deborah, did you want to talk about the aging population?
Sure.
Okay.
I'm sure most of you know that in line with national aging trends, by 2030, more than 30% of New Mexico's population will be over 60, which is an increase of nearly 50% from 2012. So this is a big topic and a big concern and a big initiative for the rural transit programs. We're trying to get ahead of this, and we're starting now, and that's why we're embarking on some new projects, and we're expanding our connections with health providers, tribal health councils, and the like to really dive into this issue and get ahead of it, like I said. So between 2010 and 2020, the population of New Mexicans aged 65 and older grew by 43.7%. I mean, that's, for a population of only around 2 million across the state, that's a large statistic. So we're starting working on different projects across the state, which I'm going to talk about in the next slide. So elsewhere in the state, we're studying the intersection of transportation and healthcare. And we started this discussion last year at our annual transportation conference. And I intend on extending that to a second year this year, where we invited behavioral health providers, healthcare providers, individuals from the aging and long-term services, people from the veterans. We had small rural transit providers there. We had non-emergency medical providers, and we're trying to identify specific populations most affected by transit-related disparities, understand how these transportation costs, the isolation, and infrastructure deficits are really affecting access to care, and where. And we really want to identify a scalable and culturally appropriate solution for rural and Native American communities to address these issues. Next, please. Areas of focus: healthcare access, distance gaps, and again, like Meredith said, the walk study. So AARP actually has put together this great walkability survey, and you can involve different groups in a city to conduct this. So we're looking to involve like senior centers and other nonprofit agencies that serve the public that we really want to provide access to conduct these studies in their own regions. We're looking at public transportation infrastructure, economic and logistical burdens, impact on vulnerable and underserved populations. Again, that tapestry analysis is going to help us identify those areas. And then we're looking specifically too at emergency and specialized care gaps. Next slide, please. So these are some of the upcoming projects that we have real quick. We're starting in the southeastern part of the state. We're examining transit development and planning for Hobbs, Artesia, Clovis, Portales, Alamogordo, and the Mescalero tribe. We're, again, it involves an existing condition scan, quality of life analysis, health assessment. We're looking at service options, including a microtransit analysis. We're going to be making recommendations and then implement our plans. Next, please. So we're always looking for ways to collaborate. We really appreciate being invited here to present. Tribal health councils across New Mexico we know you're being supported with training, capacity building, and resource development to better serve their communities. And that same type of support that strengthens your initiatives to serve your communities is the same, is also critical for our public transit space, so that we can collaborate and work together. And a lot of times we already have systems in place that we just need to coordinate better. So we're really looking forward to continuing this discussion, and we want to really appreciate and benefit from the close consultation and partnership that we've developed. And thank you again for inviting us to make this presentation.
Of course, thank you, Meredith and Deborah. Oop, there's another slide here. Okay, partnership.
Yeah, it's just
Yeah, this one's just describing like
yeah.
why it's significant, why public transit and healthcare we should all be partnering all the time.
I definitely see alignments here, obviously within the public health infrastructure, county and tribal councils, the particular piece around community health assessments. That's a function of health council, such a great alignment there. So to not duplicate efforts, but strengthen. The questions are rolling in, Deborah and Meredith. Friends, you'll find Meredith and Deborah's contact information here. Of course, we'll share the slide. We have baked in 10 minutes of a break.
Sorry, Valeria.
I think it's important to get to some of the questions if folks are willing to stay with us. Does that work for you, Meredith and Deborah? Do you have a few more minutes?
Sure.
Okay. So our friend Faith wants to know if there is a plan to reopen a route between Shiprock and Farmington. It was closed during the pandemic and it remains. So any plans to open it back up?
So when we were talking about the partners in the slide previously with the Hope Project, that is one of the challenges that Navajo Nation has at this time. They have a gorgeous transit fleet and not enough drivers to be able to even operate all of the routes that are currently needed. And that's why I made a reference to Northern Arizona Council of Governments, because they are the ones pursuing an additional transportation planning grant to be able to support Navajo Nation. I think that was the reference to their large service area size is when things did get scaled back during COVID, it had to stay that way because, again, there were so many changes with staffing and resources. It made it really difficult to be able to expand. So there is a likely outcome as a part of the Gallup Hope Project that we would make that recommendation to expand service out there. But again, there has to be incentives for drivers and driver retention. And that problem is not unique to Navajo Nation. It is a national issue right now. So it's a good thing that we're getting some support from the Northern Arizona Council of Governments because it's such a huge undertaking. I don't think it could be done. We can't all do it alone. It has to be a collaborative effort.
I love it. Thank you, Meredith, for that update. Our friend Hector wants to know if tribal members who are seeking transportation, health transport, would this be provided free? Are you all collaborating with MCOs to initiate a discussion if it hasn't been? Oh, I see Tiffany responded. Is that right?
Yeah, MCOs should be encouraged to add monthly Metro cards. So service can't possibly be free because that's not exactly how it works unless there's some sort of special grant that allows for free service. But in that particular instance, usually there are partnerships with nonprofits and then the healthcare organizations to be able to provide buy in bulk passes and be able to provide them to the individuals who need that type of service.
Thank you, Meredith. So great to see that there's that encouragement, obviously, because there's that alignment with MCOs. Our friend Carrie Moore from Chavez County highlights that Roswell is 200 miles to any major city, and their Greyhound has been reduced to 2 days, the services, 2 days per week. So folks have to go south to El Paso and then transfer to go to Albuquerque, hence emphasizing that rural transportation is in, obviously in so many other areas of New Mexico, but it sounds like you have a set priority list, right?
Deborah, do you want to respond?
Yeah. So, yeah, I know that service has been diminished to just 2 days, and we are looking at reestablishing these the Greyhound routes that we're running. We're just working on one one section of the state at a time. So I do appreciate your question, and we will be looking at that when we're in that southeastern part of the state doing our assessments.
Beautiful. And in that wheelhouse of assessing, Hector brings up looking at potential risk factors in regards to walking distances as it relates to MMIW. Hector, do you want to chime in what the acronym is? Maybe not everybody knows what that is. Or if somebody
Val,
knows.
it's
Yes.
the missing murdered Indigenous woman.
Thank you so much.
Thanks, Geraldine.
Mm-hmm.
Potential risk factors in regards to walking distances. That's an interesting question. I like that question, Hector. So in general, we already are acutely aware of what the issues are relative to pedestrian safety in New Mexico. But I would be curious to see if there is either a nonprofit group working on those particular cases, or even law enforcement, because they were at the safety summit too. That would maybe, is there a way we could look at that in a collaborative effort? I think it's a great question.
And I believe there's a task, there's also a task force that emerged from either this session or the previous session. And we can figure out, perhaps with Hector and others here, how to make that connection with you all, Meredith and Deborah. I see a couple of more questions. Rural stops identified through the tapestry analysis be considered for other services like small groceries, stores, food depots, and the like. So those essential services.
Yeah, so we would take the traditional tapestry analysis from any given point. So like, let's say, similar to Nagizi, we're on tribal lands, and there's like a central point. You could do the tapestry analysis from any distance and then map the areas that people want access to. So I think this question is really looking at what we would call food deserts. So then what are the nearest stores where we can access things? And if they are not close, how do we create access to those much needed quality of life things? So the short answer is yes.
Beautiful. And on that note too, Sandra expands that conversation around transportation barriers with healthcare services. Also the cost for families, rural families in traveling to larger cities to get access. So she's expressing her thanks for the important work that you're all doing. Our friends from Hardin County has transportation program for locals. It is specifically prohibited from transport to an emergency room. So there's a transportation gap there. Jerry, if you want to chime in, if I didn't convey that clearly, feel free to unmute yourself.
That's correct. It took me a minute to find the mute button. But the transportation program is not a commercial program. We can't charge. And they're prohibited from going to the emergency room. You have to call the emergency services for that. And there's two of us. There's two EMTs in Hardin County. So we do have the capability. And our EMS service is a rescue service, so they're not allowed to charge either. They're funded mostly by state funding.
Thank you, Jerry. Any thoughts, Meredith or Deborah? Or
Deborah, do you want to respond to the statewide one in this question, and I can back you up?
Yeah, I mean, I know that about Hardin County, and that is on our radar. And but these are the problems that we're looking to solve. So we, a lot of our smaller systems that are actually funded in some of these small counties, most of the riders that they serve are riders that they're taking to and from healthcare services, right? And so in a lot of instances, we're already providing that service at a very low cost. It's like $1, $2 to transport them. So these are the areas that we want to break into. So I'll make sure that we put this up on our priority list and try to see if we can maybe coordinate something, based on who in the surrounding counties to you, who's offering services and how we can, potentially coordinate. I also want to say too, that we have a program where we award capital funding for vehicles at an 80-20 match for services to individuals with disabilities and seniors. And so that's another way that we're starting to solve some of these transportation gaps by awarding small senior centers the vehicles. And then they can, then they're in their local communities, and then they can coordinate some of those trips, because that would be an eligible trip. So if you have a senior center or an aging center or some other type of nonprofit that provides a service to either individuals with disabilities or seniors in your county, we can link them up with a vehicle to start providing some of those trips.
That's incredibly helpful, Deborah. And if you could send us that information too, because we can include it into this follow-up with CCF members and in our, disseminate that information through the network of county travel health councils and many more. And then just highlighting Angelica and Melinda, if it hasn't been included already in your priority list or studies, Demen, Columbus in Luna County, and of course, Torrance County, particularly with Edgewood, transportation lacks there to and from Albuquerque. Beautiful, team.
Thank you.
Yeah. Any additional information you all want to share with us? This is the perfect space, Deborah and Meredith, to reach partners at the local level too in these various intersections of transportation and understanding more deeply what communities, face in terms of barriers. We're in this together, my friends, and thank you. We see that everybody stayed on. These were very important conversations. If there's any additional questions, please include them in the chat. We'll be sure to forward that to Meredith and Deborah and our previous presenters. And now we're going to turn to Deputy Cabinet Secretary Alex Castillo-Smith from the New Mexico Healthcare Authority to give us some timely updates on Medicaid, Medicare, affordable insurance, SNAP. Thank you so much, Alex, for being with us today. Really appreciate you taking time.
Hi, can you all hear me okay? Okay, good. Yeah, no problem. I'm really glad to be here. Good morning, everybody. I'll go through these slides and I'll try and go through it quickly. That way we have time for questions or comments that you all have. So this is the vision, mission, and goals of the Healthcare Authority. Wait, sorry. Can we go back? I'm not sure. I can also screen share. Yeah. If that's helpful. So this is the mission, vision, and goals of the Healthcare Authority. And I think especially as, we're just experiencing a lot of change at the department this calendar year, primarily because of federal policy changes, but it has not changed the mission, vision, goals that we established in 2024. I think it's more important now than ever that we ensure that New Mexicans attain their highest level of health by facilitating access to high quality healthcare and safety net services. And so I'll talk a little bit about the changes that we're seeing federally. But for me personally, like as I think about this season that we're in, my colleagues and I are talking a lot about how we still try to leverage our position as the largest payer of healthcare in the state for getting better health outcomes while also achieving health equity and addressing the structural determinants of health and well-being. So If you can go to the next slide, please. On the left-hand side, you see that nearly 40% of all New Mexicans across the state receive at least one of our programs. And this is data from September, but I think really importantly, for both Medicaid and SNAP, New Mexico has the highest percentage of residents enrolled in those programs compared to any other state in the country. That means that, I mean, I'm really proud of the fact that what that tells me is that this agency does a good job reaching the people who need these programs and getting them enrolled. I think if there's a downside to it, it means that New Mexico will have a disproportionate impact compared to other states about some of these federal changes we're seeing. So if you go to the next slide. I thought this was important just to mention, and I'm sure you all have seen the social vulnerability index that the CDC has put together. The CDC established this metric several years ago to try to measure the degree of social vulnerability that residents of a county experience. And New Mexico is one of the most socially vulnerable states as measured by the CDC metric. There's 16 variables that are grouped across 4 themes that go into determining a county's level of vulnerability. It could be racial, ethnic identity, socioeconomic status, household composition, but over 60% of all New Mexico counties fall into the highest social vulnerability index quartile. And some of our counties like Bernalillo, McKinley, and Doña Ana are among the top 5 most vulnerable counties in the country. I wanted to bring this up because before I talk more about HR1 or other things that may be happening, I think it's important context to understand that a county or a state or a community's ability to respond or adapt to disasters, for example, or just change is dependent on its level of vulnerability. Something that I know you all understand very intimately. So I know I'm sort of preaching to the choir here. But for me personally, I kind of see what's coming and what's already happening in terms of these changes as a kind of disaster. In the way that the COVID-19 pandemic was a natural disaster, these federal changes are just among the most seismic changes to happen to our safety net programs in generations, and just the lack of time, like for our department to prepare to respond effectively, and for the country to respond. To me, it just sort of feels like a type of man-made disaster. So we just, as we think about how we prepare and respond to this, we're very cognizant of the stressors that this will have on our communities. So if you can go to the next slide. So HR1, House Resolution 1, that was enacted by the president in July, affects every New Mexican, regardless of whether or not you're on Medicaid, you're on SNAP. Because Medicaid is the state's largest payer of healthcare, the ramifications of the changes in Medicaid financing that are to come will affect anybody who gets care in New Mexico. So it's likely that insurers will pass on higher costs to individuals with private insurance to make up for the reductions in Medicaid reimbursement. The New Mexico Hospital Association projects that 6 to 8 rural hospitals may close within the next 18 and 24 months because of the reduction in Medicaid payments. And, you know, I know you all know this also, but when you have changes in health in health insurance coverage, eligibility access, it means more people forego preventive care. And we can see right now what's happening with SNAP and the shutdown, just the economic impact of states lacking access to SNAP funding. We get in New Mexico $1.3 billion a year in SNAP benefits. And that, I mean, it not only supports the nearly 500,000 New Mexicans who receive SNAP benefits, but more than 1,700 New Mexico grocery stores, farmers markets, gas stations, places where people buy food. So it's really important. If you go to the next slide. I'm sure many of you have heard of the Healthcare Affordability Fund. It's a state fund that was established in statute. And the purpose of the fund is to lower premium and out-of-pocket expenses that New Mexicans and small businesses on Be Well, our health insurance exchange, receive. And so the legislature, this administration, had really great foresight to create the Healthcare Affordability Fund several years ago, because it's doing exactly what it's meant to do. And it's in a place where funds are available to respond to changes in federal policy on healthcare coverage access. So there are, because of HR 1 and other federal changes around the marketplace, if we did not have the Affordability Fund in New Mexico, we could have seen anywhere between 15,000 to 27,000 New Mexicans lose coverage on the exchange. We still may likely see some of that because there are new administrative barriers, there's changes in eligibility on the marketplace that will make it difficult for some people to retain coverage. But the special session that occurred in September, the legislature appropriated additional funding to our department so that we can provide premium insurance or premium assistance to New Mexicans over 400% of the federal poverty level, should Congress fail to act by the end of this calendar year and not continue current subsidies that many people on the exchange get. If you go to the next slide, this is, I think you may have heard in the news that the marketplace subsidies is like one of the primary drivers that resulted in the shutdown occurring. But regardless of what happens in DC, we're lucky to have the fund here in New Mexico to step up. In our budget request for state fiscal year 27, the Affordability Fund staff were requesting funding for coverage protection programs. So on the right-hand side, it's a pretty detailed table, but you can see sort of whether it's across Medicaid and CHIP, the marketplace, or Medicare, changes in eligibility for those programs for lawfully present immigrants. I won't go into it because it's a little nuanced, but what's important as it relates to the marketplace is that there are currently 920 lawfully present people under 100% of the federal poverty level who are getting New Mexico marketplace coverage today. They will lose their eligibility for the marketplace in January. The Affordability Fund is working with our partners to ensure they have coverage access that is entirely funded by the fund. There are DACA recipients, dreamers, who are also losing eligibility for marketplace coverage. They lost that eligibility earlier this summer, and we're using Affordability Fund dollars to continue to provide them coverage access. Next October, a larger number of individuals who are lawfully present immigrants who currently are eligible for Medicaid, they will lose that Medicaid eligibility. And so from a fiscal standpoint, that's it. That's a large amount of funding that the Affordability Fund will need to use to sustain coverage for this group. But right now we're prepared to do so. Should we get the funding to do it for the legislature in 27. So as you can see, it's lots of changes. We're not only able to help sort of facilitate coverage, access, and affordability for people who will still have eligibility for the marketplace, but we're also thinking really creatively about how to facilitate coverage access for people who are losing marketplace coverage. Then if you go to the next slide, I talked about this just at a high level a few moments ago, but we estimate that by 88,000 New Mexicans will lose Medicaid coverage as a result of HR 1. There are new, work requirements, administrative requirements to submit documentation, to attest and reattest your eligibility. We think that more than 250,000 New Mexicans will be subject to that increased administrative burden. I do not know the hospitals that are projected to close. Those projections are coming from the Hospital Association. But that's what they're projecting. Yeah, and we got billions of dollars of revenue from Medicaid, and we stand to lose nearly $9 billion in federal Medicaid funding over a 10-year period beginning in calendar year 2028. So it's pretty significant. If you go to the next slide, these are just some of the SNAP changes under the HR 1. I talked about a couple of them. Right now, all state agencies require some administrative funding to operate the SNAP program. Right now, those costs were split sort of 50-50. We'd contributed some of the costs, and the feds would contribute some of the costs to help us pay to administer the SNAP program. HR 1 requires states to pay 75% of the administrative costs, meaning that they will only contribute 25%. And that change alone is forcing many states around the country to consider whether or not they could even afford to operate a SNAP program, because they don't have it in their budgets to make up for the millions of dollars that they would have to find somewhere to do that. I feel fairly confident that we will continue to have a SNAP program in New Mexico. And I think it's in part because, unlike a lot of these other states, are in just much more dire financial straits compared to their state budgets. We're lucky in New Mexico that we have pretty healthy reserves. And there are already work requirements in the SNAP program. Only a small number of adults are subject to SNAP work requirements. But because of HR 1, that's expanding quite significantly. And I would be remiss if I didn't mention that there will be work requirements for Medicaid members as well also. And the requirements across the two programs differ. They're not exactly the same. And so communicating those changes to people who receive both those benefits communicating the changes and the requirements very effectively will be really, it's a priority for us because we want to make sure people can stay enrolled if they're eligible. But as it relates to SNAP anyway, we think 55,000 New Mexicans will be subject to these work requirements. And about 20,000 New Mexicans may lose their benefits in SNAP altogether. This might be my final slide, but let's see if I had, yeah, that's my final slide. Happy to stay on for a few minutes and answer any questions or take your comments.
Thank you, Alex. That was very timely, incredibly informative, sobering, but also laying out a lot of opportunities for alignment, right, between our state partners and local partners. And we have April, who is noting here 4 slides that highlighted Medicaid and SNAP benefits. Are there percentages, break codes, so that we know where those pockets are?
Can you ask that question again? I just want to make sure I understand.
April, would you like to chime in? Maybe I did not phrase it correctly. Sorry.
Good morning. Can you guys hear me okay?
Yes, we can, my dear.
Okay. My question was just the slides that you have provided for Medicaid and SNAP benefits. Are those percentages able to be broken down to the zip codes within New Mexico?
Oh, zip codes? I don't know. I'd have to ask my data team. I'm not sure in the time that I've been at the department that I have seen SNAP data aggregated by zip code. It's a good question. I can ask though.
Thank you, April. And Alex, we can also provide some insight around that too, with regards to the inquiries that come through Sharon M by zip code around food accessibility, Medicaid, and those sort of elements, essential services, sorry. And then Shelley asked, is there a way for tribal entity to locate numbers of members who are on SNAP?
We do share that information with the tribes and the nations and the pueblos. Let me see something. I'm going to our website because we may have a resource there that I can point you to.
Go ahead, Shelley, while Alex is looking.
Hi. Thank you, Val. And good morning, everyone. Good afternoon, wherever you may be in the state. I wanted to just clarify on that and appreciate this presentation. It's very helpful. And I do work with our Pueblo of Acoma Health and Human Services Division, as well as the Acoma Community Health Council. And we right now are working to address the cuts as well as impacts for members, and just wanted to be able to see if there's a way to have immediate access, or is there a way that I could put in a request potentially before tomorrow to be able to then share that up on what is the current status when we do begin our food drives and prioritizing whether individuals are able to do a drive-through, or if we need to do home visits across the villages.
Yeah, let me screen share this resource, may be helpful. So can you all see what I'm sharing?
Mm-hmm.
Okay. So this is our homepage. So if you just go to hca.nm.gov, it'll take you to our homepage here. And we have an interactive customer map. And so what you could do is click on filter. And so like right now, you can see that our unduplicated customer count is 838,000. If you, so you can narrow it by program. So let's just say I'm only interested in SNAP. You can also see here this tribal affiliation filter, and so just Navajo Nation, for example. And you can select more than one affiliation if you wanted to. You click on close, and this will tell you that there are 30,959 members of the Navajo Nation who are on SNAP only, who are getting SNAP benefits. And then you can hover here and so McKinley County, that's the unduplicated customer count number, for example. So that's available, and that's available anytime on our website. And I think as it relates to a point of contact, you can just email me and I'll connect you to our SNAP team. We have SNAP team we have colleagues on our SNAP team that do a lot of outreach in tribal communities, and I'd be happy to facilitate that introduction so you can get more detailed information.
Thank you so much, Alex. Sounds like Shelley's appreciating that resource. We've also put it on the chat. We see you, Juliana. Guillermina, I see you have two questions. You want to unmute yourself, my dear, and ask away?
Yes, I was wondering, I don't know if this has been asked before, but when we're talking about Medicaid provider reimbursement cuts, are we planning for sure to start reimbursing per service the providers at a lesser fee than we were reimbursing before? Is that part of the plan?
Juliana, I can only hear part of your question. Your volume's really low.
This will
okay, that was much better.
Yeah, sorry, I forgot. I was wondering if part of the cuts in Medicaid coming up for providers, hospitals, etc., is an actual plan to reimburse providers for their services less than the current rate of reimbursement. And I'm asking because I've just opened a whole mental health agency that only depends on Medicaid reimbursement, so I need to know.
So HR 1 doesn't have any changes to any specific Medicaid reimbursement codes. What's changing are what's called state-directed payments, provider taxes. We have a couple of those in New Mexico. So for example, nursing homes in New Mexico said to the state, hey, can you impose a tax on us? It doesn't really happen very often where you get providers or businesses asking to be taxed. But in the case of nursing homes, they said, hey, impose a tax on us. We did. We take the tax money that the nursing homes pay and we match it with federal Medicaid funding. And then we return it back to the nursing homes. And those that have higher quality measures get a higher share back. And so we have the same arrangement with hospitals. This is a newer tax that hospitals are getting in New Mexico, and in the state fiscal year that just ended, New Mexico hospitals got over $1 billion of revenue through this program. That is what's going to be changing beginning in calendar year 28 as part of HR 1. The federal government will not allow states will not allow states like New Mexico to leverage as much money in these taxes. And so our estimates about the $9 billion in lost federal Medicaid revenue is in large part due to the change in that tax structure. There really is not a way for any state to use state money to make up that kind of difference.
Right. Okay. So it's more like at a large level, it's not like the little provider is gonna all of a sudden get half the rate for their services.
Not today. I think, though, I do just want to say, just some transparency, that, you know, we've done a really great job in New Mexico in raising Medicaid reimbursement rates for services like primary care, behavioral health, children mental health services, and for specialty care too. It's significantly above what Medicare pays for those services in New Mexico.
Yeah.
To do that, we needed to get federal approval, which we did. But in just full transparency, any administration could change their mind about that arrangement. So we're not anticipating any change like that anytime soon, but it's just something that we just monitor.
Okay, well, it's good to know that it's not in the books yet. At least I don't have to start to change the whole structure of how I do things yet.
No.
Okay. Well, thank you so much, Alexis. I appreciate it.
And thank you so much for those questions. We have Guillermina Osoria. Are you still with us, my friend? I think you have a couple of questions.
Yes, thank you, Valerie. No, es Valeria, disculpa. Disculpa, mi amor. Gracias.
Está bien, querida.
Alex, thank you for your presentation. It's awesome. I'm contract with Health Action New Mexico, so I'm one of the outreach coordinators for the Northern region. My question to you is there a way to look at that map that you shared that gave us the numbers of Medicaid and SNAP recipients that are losing? Is there a way to look at those numbers by zip code and county? That will help with planning and setting up these workshops and inform events in our community, especially in those rural areas. Is there a way to look at those numbers?
Thanks, Guillermina. I think we don't have the projections of who could potentially lose coverage by county. It, in part because it depends on like the action of the individual SNAP members or what they may choose. So I think I would, if you're wanting a proxy, I would just target those counties. If you go back to our homepage and look at that map, let me see if I still have it up. So let me just clear this. And then look at SNAP. So this is the customer count just for SNAP. But if you click on percent, you can see here the counties that have the highest percent of county residents enrolled in Medicaid. So my suggestion would be to start with the counties that have the highest percentage of residents who are in SNAP. But then I would also just look at that other map I shared with the social vulnerability index and just target those counties that have the highest degree of social vulnerability. As these broader work requirements, community engagement requirements, kick in next year, we will be able to see who is losing coverage. And so at that point, it becomes easier to see where we may need to like retarget our outreach.
Thank you, Alex.
Thank you, Guillermina. Muchas gracias. And Alex, thank you. Let's see if there are any other digital hands up that I may have missed. Apologies ahead. I'm not seeing if folks give me a digital thumbs up if you're feeling complete. But Alex, it would be great to, and this goes for our state agency partners and NDOH, everybody, to stay in close communication with you, obviously, as not only are we as we navigating these changes and looking at the implications in New Mexico, but as we step into the legislative session, planning next year, where are those opportunities where we can self-inform, self-mobilize, self-organize, as you noted, and as I highlighted at the beginning of the convening, that this is truly an emergency response 2.0, right? And we have the network that we need to get us through it, the expertise, the resources, the creative thinking, the local networks, and so forth. And so we look forward to staying in touch with you, Alex, and staying informed. And for folks, CCF Hub online, Sam is going to put the link on the chat. This is where we're streamlining communication updates from our state partners like Healthcare Authority, from the executive branch. We just learned that there's going to be another special session on Monday, November 10th. So as I get more information, I'll send that to you all as well. So please do stay informed and connected. Alex, any last words before we continue to our next update from our Senator Ben Lujan?
No, just thank you all for what you do every day. Appreciate it.
There were, sorry, a few folks who were interested in if you'd be willing to share your email.
Yes. Thank you, Sam. Beautiful. Beautiful, beautiful. And up next, we have our dear friend, Eric Chavez, field representative from the office of the our U.S. Senator Ben Ray Lujan, representing New Mexico. Let's make sure Eric is here with us. Hi, Eric. Are you here with us?
Hi there, Val. Yeah. Hi, everyone.
Good to
Can
see
you all
you.
hear me good?
We can hear you, my friend. We can hear you.
Oh my goodness. Thank you so very much, Val. It's great to be with you. And thank you for that wonderful picture. You got my good side in that picture right there that you put up on there. So I really appreciate that. It came out great. Hey there, Julio. Hey there, everyone in the chat. Again, my name is Eric Chavez. I'm a field representative for U.S. Senator Ben Ray Lujan's office, and I'm based out of our Santa Fe office. And it's so great to be with you to provide a federal update as best as I can with a lot going on. And it's just a privilege to join you all today for the Community Collaborative Forum. And of course, I'm always honored to share a few words on behalf of U.S. Senator Ben Ray Lujan. And I want to start by thanking, of course, the New Mexico Alliance of Health Councils for bringing, these leaders across New Mexico all together. I'm grateful that you're all working together to listen to each other, learn from each other, and improve the health of all New Mexicans across our state. And your work is invaluable. And that's not my words. Those are the senator's words that he shares with all of you. And so just to kind of jump on into it, today marks the 37th day of the Republican shutdown. This is the longest government shutdown in U.S. history, and Democrats are fighting to reopen the government, but congressional Republicans and President Trump continue to use this shutdown to hurt the American people, threatening jobs, driving up costs, and refusing to stop the rising healthcare premiums that, as we heard earlier from the Deputy Secretary, are going to impact many across the state. President Trump is putting, of course, himself and his billionaire friends ahead of hardworking Americans. Families are starting to receive notices of skyrocketing healthcare premiums as open enrollment begins this month. For New Mexicans, Affordable Care Act premium tax credit support can mean up to $7,000 a year in savings and is a lifeline when groceries and electricity are already more expensive. This week, President Trump let the SNAP funding expire, which was, as we all heard, of course, November 1st. This threatening the livelihoods of more than 450,000 New Mexicans who rely on this program. Those are children, elderlies, family members. And although 2 federal district courts have confirmed that we already knew this, but they have confirmed that the Trump administration has the legal authority to fund and to ensure that no one goes hungry as they rely on these SNAP benefits. Yet the Trump administration has again chosen to withhold SNAP funding from folks who, of course, need it most. Senator Lujan continues to urge the Trump administration to use its transfer authority to fully fund November benefits so that no family should go hungry because the Trump administration continues to play political games. Also, House Republicans have been gone for almost 2 months. Senator Lujan has been in Washington fighting to reopen the government, standing up for New Mexicans' ability to feed their families and working to protect affordable health care for all New Mexicans and for Americans across the nation. Senator Lujan will continue, of course, to show up and speak out for the people of New Mexico. And we're so very grateful for everyone here for the hard work that you all have done for our state. I do want to also share that Senator Lujan's office does have a resource FAQ link on his webpage, on the senator's webpage. I'll put that in the chat. And it has some information regarding the shutdown, how people may be impacted right now. It answers certain questions such as how are my Social Security checks going to be impacted? How will my veterans services be impacted? Things like that. Social Security checks should be continuing to go out for your Social Security and your supplemental security income checks. It's other things like the wait times and expected verifications of benefits, replacements of Medicare cards, and overpayment processings that may be held up at the Social Security Administration. As you all know, hundreds of thousands of folks are furloughed right now. Also recently, Senator Lujan and Senator Heinrich, as well as other members of the congressional delegation, sent a letter to the U.S. Department of Interior Secretary Doug Burgum, urging the Trump administration to reverse course on its decision to initiate the process to fully revoke the public land order number 7923, which currently protects the area around Chaco Canyon from oil and gas drilling. I know that's maybe a little outside of the focus on this conversation, but I just want to highlight the importance of that. So that has been a longstanding topic for many, many years, and is very important cultural and sacred site to many, many pueblos across the state. I also want to highlight that Senator Lujan also did issue a statement after the New Mexico Healthcare Authority released its new tool that allows New Mexicans to calculate an estimate on how much health premiums would increase if congressional Republicans fail to extend the Affordable Care Act premium tax credits. And of course, the senator highlights how we see that, if those tax credits are not extended, premiums will skyrocket for many, many folks. Also, the Senator Lujan, as a ranking member on the Senate Agriculture Committee and Food and Nutrition Committee, and also as a member of course, the Senate Democratic Caucus, introduced the Keep SNAP and WIC Funded Act of 2025. This legislation prevents the Trump administration from illegally withholding available funds for the Supplemental Nutrition Assistance Program, SNAP, and the Special Supplemental Nutrition Program for Women, Infants, and Children. This bill was introduced, and I don't know if you all may have seen it last week. The senator was on the floor where he went, where he had a very intense toe-to-toe argument, or I guess debate, if I will, with Senate Majority Leader Thune regarding keeping the government open and this program here as well, this act. So I will put that in the chat there for the folks as well to see. There's a link to that. On top of that, just at the end of last week, Senator Lujan, Senator Wyden, Senator Padilla, and 12 of the Senate Democratic colleagues joined together in slamming the Department of Health and Human Services Secretary Robert F. Kennedy for firing federal employees working on the front lines of America's opioid crisis at the Substance Abuse and Mental Health Services Administration, as we all know, SAMHSA. HHS has now terminated more than 100 SAMHSA employees since the start of the Trump administration, reducing its staff to less than 50% capacity. And of course, we all know SAMHSA provides key substance use disorder and mental health treatment services with a focus on rural and underserved areas. And so the senators sent a letter regarding that, and I'll definitely put that in the chat as well as we continue to get through this. A couple of weeks ago as well, the senator held a teletown hall, and that teletown hall had thousands of attendees across New Mexico, calling in, of course, asking questions about SNAP, Medicaid, what's going on in DC. And the senator was able to engage with those folks and have a good conversation with them. So we continue to work on that. Right now, the Senate is in session, and there's been a lot of conversations on nominees, and we are still waiting to hear back on how things or if negotiations are happening regarding a continuing resolution or a bill to reopen the government. But with that, those are kind of the big highlights right now, and I will stop there, hand it back to you, Val, and happy to take any questions or concerns as well.
Thank you so much, Eric, and please extend our gratitude to Senator Ben Lujan for his leadership, his hard work, taking a stand for New Mexicans. Yeah, I know we're so grateful for him and our New Mexico congressional delegation in DC. Yes, my friends, if anybody has questions for Eric, please unmute yourself or chime in on the chat. We'll read it out loud for you all.
I have a question. This is Maggie McCowan with the New Mexico Behavioral Health Providers Association. And Eric, I just would like for you to elaborate. This is just wishful thinking, I'm sure, but elaborate on your last comment about discussions ongoing about how to bring this fiasco to a close. Do you have any best guess or thoughts about what we should look for, what we should support as that's going forward?
That's a good question. Right now, it's been a lot of nominee hearings, and there has been very little forward-moving negotiations on how to reopen the government. But it's definitely important, if you continue to keep your eyes on anything that does pop up, to reach out to our offices, to our office to flag concerns, thoughts, ideas. Definitely Senate Democrats and of course Democrats continue to work to fight to protect the ACA premium tax credits extensions, and of course are continuing to fight to lower healthcare premiums and healthcare costs, and to reverse the the cuts from the one big beautiful bill that cut Medicaid funding. These are key priorities, of course, as well as working to ensure that SNAP recipients and SNAP benefits continue to go out so that New Mexicans and folks across the country are helped. And so just continue to keep your eyes on that as well. But as far as negotiations, as I said earlier, it's kind of been very limited. So hopefully we'll hear more as we go into the weekend and early next week. But right now I don't have too much more other than that.
Thank you. But my thought is, and I guess everybody has the same thought, is how much is enough? How much is too much? At what point is it in the future? Is this? I don't know. I guess there's no answer. Just want some sense of closure.
Thank you,
I totally hear you. I'll pass those concerns to the senator, of course, just to share that, you know, as we continue to track this.
Thank you, Maggie. Thank you, Eric. And Eric, you have a message from Jonathan Tafoya. Thank you, Eric, for all you do. Send Senator Lujan our regards from Santa Clara Pueblo. Lots of, yes.
Thank you so much, Jonathan. And it's great to hear from our brothers out there, brothers and sisters out in Santa Clara Pueblo. Want to just send a heartfelt thanks to them as well. And I do thank you for allowing me to join Feast Day this year, just a few weeks back. It was definitely a great time. And so thank you, Jonathan. I will definitely let the senator know.
Beautiful. And Sam has also included Senator Ben Lujan's URL where you can learn more about the work that he's leading. And Eric, if there's any other ways that folks can connect with your office, yeah, any additional information. Oh, I see. Thank you. That's very helpful.
Yeah, let me put those links in the chat, Val, and then I will also put my contact information as well in the chat. So hopefully if folks stay on just a little bit longer and then be able to kind of put that in there. I'm gonna put the links to those to the recent articles and information that has come out from the senator's office, but continue to stay engaged with us, reach out to us if there's concerns as you're tracking legislation, not only this legislation, but other legislation as well, as we move into the future on other things. Senator Lujan's office continues to put out pressers or links to the letters and things that he signs on to or that he sends to secretaries, as I mentioned, to the letter to Secretary Kennedy regarding his firings and the rifts that are going on within that department. There's also good legislation that the senator has also introduced, which also, now that I actually comes to mind, and now Senator also, along with Senator Heinrich, did introduce a piece of legislation called the True Shutdown Fairness Act, and that piece of legislation would immediately restart pay and provide back pay for all exempted and furloughed federal workers, service members, and federal contractors during the shutdown. And this legislation also would prohibit any reduction in force while the federal government is shut down. Unfortunately, that piece of legislation was blocked by Senate Republicans. That was just an unfortunate thing that happened about a week or so ago. But there are ways that Senator Lujan, the delegation, are continuing to fight to ensure that folks get paid and get help and get assistance during this. But please take a look at those. And again, always here. If you ever want to chat, you know, reach out, even a cup of coffee or event. I'm here to listen, here to work through it. And so thanks so very much, Val, for all the work that you do and for everybody here, for all our deputy secretaries, our leaders, our tribal leaders across the state. You're all invaluable to the work, to helping our communities. So thank you so much.
Thank you, Eric. We're definitely in this together, my friends. So appreciate you being with us today, all of you, each and every one of you, and Eric for carving out time to be with us and provide us these very, very important updates from our New Mexico congressional delegation in DC, and our gratitude to Senator Lujan and everyone else. Thank you for staying a little longer with us, my friends. We just have some timely updates. A big heartfelt thank you to all of our presenters, of course, Lieutenant Governor Howie Morales for his remarks and welcoming remarks and message this morning of our collaborative spirit, right? That's one of our many superpowers, my friends. So thank you all. If we go to the next slide, update, I do see a lot of you who have been signing on to the CCF online hub. This is where you'll have access to the recording, the slide deck, all of the updates, information, updates from now coming up, the special session next Monday, connections with our state agency partners, ways that you can actually search who's near you. So Sam's going to do a quick little demo. In thinking about emergency response efforts, right? Looking at who's near you working on similar areas of services for our communities or priorities or needs. Sam, if you can increase the viewing, because it's really, really small. But it's basically designed kind of like a social media platform. There's a feed. There's an area where you can include your upcoming events, the resource guide with all of the recordings, contact information. And if you go to members, and this is where I wanted to really draw your attention, Sam's going to click on near you. And Sam will then be able to see who are the people closest to her and then hover over their profile to learn more about their work, right? And so here we have Shannon Barnes working in Valencia County, the Valencia County Health Council, very much focused on, public health policy, assessments, accreditation, community health assessments, and so forth. And so when we're thinking about essential services, right, food, transportation, housing, behavioral health supports, this is such a great tool, instantaneous tool to see who's near you, working on what, and then you can chat them directly to start exploring opportunities for collaborating. We're thinking about food drives, coat drives, holiday drives, school supply drives. There's just so many things that all of you are working on. So this is such a great way to self-organize, self-mobilize, and collaborate in service of communities statewide, right? As we navigate these times together. And then the other update that we wanted to share with you all, we're always thinking of ways to connect and communicate, right? So, oh, sorry, I jumped forward a little bit. Feedback. These CCF forums are curated in response to what is most important to you, to what pressing priorities you're facing, you want to learn more about from our state partners. So we're sending out obviously a survey that's going to inform the April 1st CCF. But in the meantime, we wanted to do a little poll with the 108 CCF members here to kind of check in with you how this CCF landed. So Sam, if you can launch that poll. How would you rate today's CCF? Meaning, was it relevant, informative, so on and so forth? Did it help increase, right, understanding of what we're dealing with right now, public health priorities, the current unprecedented times that we're navigating together? And so this is a quick little pulse check on how this convening landed for you today, so that we know from the Community Collaborative Forum that we're doing a good job in meeting your needs and supporting our efforts in connecting, communicating with each other, and hopefully collaborating. And so we see that 80% of you found this meaningful, relevant, informative, and did increase your understanding at more than 76%. So thank you so much. On the next slide, we want to do a gentle call to action. Folks are already, CCF members are asking for April 1st to be a hybrid convening, much like we had back in May, on May 7th, this last spring. Why? Because we're able to come out together post the legislative session. We can debrief with legislators, executive branch, our state partners on what the outcomes from the legislative sessions are going to be in support of Public Health New Mexico, for meeting community needs, improving population health and well-being, and also from our congressional delegation from DC to have some timely updates, and then have the opportunity to break out in areas of priorities at that time with this emergency response effort. Where are the alignments? Where can we collaborate? I love Guillermina's point around really taking a look at regional, county, tribal, nation, pueblos, zip code, right? Those gaps, those areas of most concerning priorities around food accessibility, healthcare, and so forth, transportation, and where can we partner in real time and also build towards the future. So if you have an opportunity to contribute to make this hybrid convening on April 1st a reality, please email Sam and I. We'd love to have you as a partner. And mark your calendars, my friends. We've been looking at, identifying our CCF convenings for next year. So we're looking at April 1st, August 20th, and November 5th. And again, if you haven't done so, you can scan this little QR code to join the CCF forum to stay informed on all matters of public health and multi-sectoral collaborations to serve communities more effectively. And if we can move on to the next slide, Sam. In our effort, in our commitment to connecting community to resources, as a lot of you know, we have Share New Mexico. It provides the most comprehensive resource directory statewide, local, and systems. So we invite you to please revisit your profile, update your services, programs, resources. You can also set up a new profile. We have navigational specialists, Martha and Melissa, who are here, who can support you in updating your information and creating your profile. Folks have been asking in the public health sector, where can I go one-stop shop to access training opportunities? The Alliance is here, Share and M is here. You can also upload your own training, community events, food drives, food distribution, events, and so forth. So you have the URL here. As you heard from our friends at Healthcare Authority with the closed loop referral system, we're in conversations, right, on how to partner in service of community through that interoperable system. And then I want to bring in Paloma, if she's here with us, to talk about the upcoming NMPHA, New Mexico Public Health Association 22nd Annual Public Health Policy Forum. Paloma, are you with us?
Yes, I'm here, Val. Thank you.
Please come on, my friend.
Yeah, thank you so much. What a great day. Lots of information, lots of resource sharing. It's always a great thing when there's so many folks interested in public health coming together. And we're really excited to host, like Valeria said, the 22nd Annual Health Policy Forum in person on Friday, December 5th at the Isleta Resort and Casino. Registration's now open, and if you're interested in submitting a proposal as well, we have that opportunity still available. You can get all that information on our website at www.nmpha.org. And thanks so much for the shout out, Val.
Of course. And if we can, after we do the upcoming events, I want to sort of bring all of our CCF partners so folks know who's behind the scenes, putting lots of love and effort into these forums. But mark your calendars, my friends. Annual Health Council statewide meeting is going to be January 26th and 27th. We're going to be inviting partners like yourself so that we can, again, have an opportunity to see where our efforts can align. That's going to be in Santa Fe, registration coming soon. And then, of course, along with NMPHA and many others and MDOH, we're curating the Public Health Day at the State Capitol during the session, January 28th. And we have, as part of our crisis and rapid response communication efforts, there's going to be a webinar presented by W.K. Kellogg Foundation, so you can register there. All these hyperlinks, everything's going to be shared through the CCF Hub, the follow-up email that you'll get the recording and the slide deck. Also, I did mention the CCF events for next year, 2026, April 1st, August 20th, and November 5th. If you can move over to the next slide, Sam, and then bring our friends, CCF Planning Committee, if we can. Let me remove my spotlight. I don't need to be spotlighted. Just want to acknowledge Paloma Flores, of course, from NMPHA, Marie, and our health promotion managers from the New Mexico Department of Health, Karen Candidate, Amy Sandoval from Behavioral Health Division, and Colleen and Jose and many others from the New Mexico Early Childhood Education and Care Department. These are in our small but mighty team at the New Mexico Alliance, if you can come online. These are the people that meet literally weekly. Lots of hard work around curating this forum in response to you all. There's Joseph from the Alliance as well, Martha and many others. And again, know that this space is in response of you, what's important to you, how you want to the work that you want to highlight, the partners that you want to bring to the table to report out, present, provide timely updates, and really look at where our work intersects. Where can we be stronger together in serving our community members? And so I just want to extend my heartfelt gratitude to each and every one of you. Our planning committee, of course, Lieutenant Governor Morales, Senator Ben Lujan, Eric, our state partners, presenters, all of you, community champions, for your time, your energy, your dedication, your commitment to serving communities and improve the health and well-being of New Mexicans. And I think one of the things that really stands out for me today, again, is these powerful network that we are, right? Not just sharing information in this space, but really taking action, mobilizing, right, for meeting this moment, right? And we are able to reach out across various sectors, as we saw it today, to respond to community needs. And eventually, right, all of this also builds in reshaping the future of public health. We are definitely stronger when we work together. So every update provided today, every idea, every question, every collaboration that's seeded out of this space, every connection made here today moves us closer to a healthier, more equitable state. So let's keep the momentum going, my friends. Please join us on the CCF Hub. Stay connected, explore opportunities for collaborating, self-organizing, share your profile, post your upcoming events and drives and food distribution, highlight your resources. Let us know what your community needs the most, right? So that we can respond. Together, let's continue to align efforts, strengthen partnerships, and uplift the voices of our communities, because New Mexico depends on it, right? It depends on all of us working together. Thank you again for all you do and for who you are in service of New Mexico. Thank you, my friends. We really appreciate you.
Val, would you still like to offer the optional breakout room?
Oh, yes. We got a lot of feedback around self-organizing, self-mobilizing. So we are going to extend our time here if anybody's wanting to learn about partners in these 4 regions and how we can self-mobilize on some essential services like food and transportation and other priority areas. So Sam will open up the breakout rooms, and you're all, whoever's inspired, and you're welcome to come stay with us a little longer and explore this a little further. Thank you all. Have a great rest of your day and week, my friends. Take good care of yourselves as well. Sam, do we have 47?
Thank you.
Thank you, team.
That's what it looked, I think, yeah, around there right now.
Okay.
I think folks are still working on joining or,
Let's
yeah.
let's give folks a little time. Yeah, just wanting to make sure there was space if folks wanted to connect. Is this the room or are we going to a separate room, Sam?
There's a
Remind me.
separate room.
Okay.
Yeah. It should have popped up. A few people have moved over.
Yeah, 29 and counting. I'll let you take the lead on this when it's time to go to the other room. Thank you all for joining us. All right. Okay. Thank you, everybody. Take good care.